All right. This is me just reading straight through the Taggart notes. I'm going to try to get through the embalming section. Taggart notes, embalming section. But it's 40 pages, so I don't know if I'll be successful, but here we go. Definition of embalming. Process of chemically treating the dead human body to reduce the presence and growth of microorganisms, to temporarily inhibit organic decomposition, and to restore an acceptable physical appearance. Etymology. Em of embalming means in or about. Balm means resinous substance or balsamic agents. Resinous is an amorphous, non-volatile solid or soft-side substance, a natural exudation from plants. Any of a class of solid or soft organic compounds of natural or synthetic origin, or tars or tree saps. Yeah, balm, embalm. Balsamic is resins combined with oil, a fragrant, resinous, oily exudate from various trees and plants. State law regulations. Embalming is not required by law except in certain circumstances. Federal regulations include things from OSHA, EPA, and FTC. Non-legal. Embalming is a process of chemically treating the dead human body to reduce the presence of growth in microorganisms, to retard organic decomposition, and to restore an acceptable physical appearance. Decomposition is the separation of compounds into simpler substances by the action of microbial and/or autolytic enzymes. Sanitation, disinfection, temporary preservation, and restoration are the four things entailed in embalming: sanitation, disinfection, temporary preservation, and restoration. Sanitation is a process to promote and establish conditions which minimize or eliminate biohazards. Disinfection is the destruction or inhibition of most pathogenic organisms and their products in or on the body. Temporary preservation is the science of treating the body chemically so as to temporarily inhibit decomposition. Restoration is treatment of the deceased in the attempt to recreate natural form and color. Embalmer preparedness, the things involved in getting a person ready. Education requirements vary from state to state. In Arizona, to sit for NBE, you must have an AAS. Immunization, hepatitis B vaccine, HBV. Occupational hazards. OSHA, Occupational Safety and Health Administration, is a governmental agency with the responsibility for regulatory and enforcement of safety and health matters for most United States employees. An individual state OSHA agency may supersede the U.S. Department of Labor OSHA regulations. Ethical standards. Classification of embalming. There's vascular, the use of the vascular systems of the body for preservation, disinfection, and restoration, usually accomplished through injection of embalming solutions into the arteries and drainage from the veins. Surface is direct contact of internal or external body tissues with embalming chemicals. Hypodermic is injection of embalming chemicals directly into the tissues through the use of a syringe and needle or a trocar. Cavity is direct treatment other than vascular arterial embalming of the contents of the body cavities and the lumina of the hollow viscera, usually accomplished by aspiration and then injection of chemicals using a trocar. Aspirate low, dorsal side, and inject high, ventral side. The need for embalming has to do with sanitation, room, vehicle, environment, a process to promote and establish conditions which minimize or eliminate biohazards, disinfection of the body itself, the destruction and/or inhibition of most pathogenic organisms and their products in or on the body. Use aldehyde for both disinfection and preservation. Temporary preservation is the science of treating the body chemically so as to temporarily inhibit decomposition, which can be reversed by presence of wata. Change of body proteins so they become somewhat stabilized, their water sensitivity is decreased, and have a resistance to proteolytic enzymes of both the autolytic, which is what breaks down proteins, and microbial type. Destruction of most autolytic and microbial enzymes, which have protein, aldehydes work with this, carbohydrate and fat splitting ability. Restoration, treatment of the deceased in the attempt to recreate natural form and color. History of embalming. Ancient embalming took out viscera. We do not. They really practiced mummification in ancient embalming. Modern embalming uses circulatory system to arterially inject preservative chemicals. Professional conduct. Act as if the family was standing right next to you in the prep room. Moral considerations and purpose is to show respect for the dead and maintain high standards. Procedure. Keep preparation room strictly private during the embalming. Preparation room is that area or facility wherein embalming, dressing, cosmetizing, or other body preparations are effected. This is not a spectator sport. Limit admission to those who are licensed funeral service professionals and registered trainees, those authorized by the family, those authorized by law. You have to reference state law. Identify and secure the preparation room, which is that area or facility where an embalming, dressing, cosmetizing, or other body preparations are completed. It must have a lock. Maintain the dignity of the remains. Cover the pubic areas. Instruct and maintain highest moral standards. Act as if the family were standing next to you. Keep body covered as practical. Take no liberties whatsoever. Guard loose talk and remarks. Repeat nothing outside of preparation room. Disclose no confidential facts as to conditions, age, deformities, or diseases causing death. Consider establishing minimum standards for embalming procedures. Companies will establish their own procedures, refer to state law if applicable. Legal considerations for embalming. Authorization to embalm. You must get it, preferably in writing. Verbal permission is okay for temporary measure, but must try to get written as soon as possible. Written permission. Try for a written permission at removal. If unable, try at arrangement conference. If still unable, note on form who gave verbal permission and when. Authorization for procedure other than embalming must get written permission to perform. Autopsies, coroner or medical examiner can do without permission, or family can request if there's a question about the death. Organ and tissue donation requires written authorization. A major restoration, like I would like to remove or repair, would you sign, must be written authorization for a major restoration. Removal of medical devices such as pacemakers is legal mutilation with permission. They must be disposed of in a certain way. Cremation requires removal, but must still get written permission to remove the pacemaker. Cremation. Final viewings before remains are placed in retort. Identification procedures. Death asks of you who you are. Dead human remains. DNA is the best possible source of ID. Personal effects are a clue, but they're not conclusive. Personal effects are the worst possible source of ID. A blood sample with proper written authorization is good. Fingerprints with proper authorization is a pretty good method of ID. Also may use dental records. Photos with proper authorization is used frequently. Next of kin or agent may ID the body. Responsibility to report certain observations concerning situations inconsistent with presumed cause of death. Stop immediately and call as soon as you notice anything strange. Police, call them first. Medical examiner is an official elected or appointed to investigate suspicious or unnatural deaths. Doesn't do an inquest. Coroner is an official of a local community who holds inquests concerning sudden, violent, or unexplained deaths. Sanitation is a process to remove and establish conditions that minimize or eliminate biohazards. Personal and environmental hygiene. Introduction. After death, the body and its immediate environment may be unsanitary or potentially contaminated. The purpose of sanitation is to protect the public, protect the operator, embalmer, create a clean, sanitary body, must do to see signs of embalming anyway, and protect the environment. Personal note. Light a candle in the prep room to control odor. OSHA will have a fit. Bloated body equals methane. And a Bic lighter at the end of a trocar will generate a nice blue flame. Moving on, to protect the operator embalmer, wear rubber or latex gloves, possible double gloving. By law, you must wear gloves. Protective clothing worn in the preparation room, PPE, personal protective equipment. Gown, shoe covers will help prevent slipping on a wet floor. Mask will help prevent tuberculosis. Impermeable apron. By law, we must wear an apron. Gown qualifies as alternative cover. Goggles or face shield, not necessarily both. Head cover, face shield or goggles, not necessarily both. Coveralls are the alternative to a gown or an apron, not to be confused with unionalls that go on the deceased. We get the coveralls as an alternative to gown or apron. Use of disposable protective clothing. You should use disposable. On first call, you must use it. Following completion of embalming, employ maximum personal hygiene standards, which is meticulous hand washing. Get your fingernails, wash thoroughly or shower your oral or nasal cavities. You may swab out nose with Windex to neutralize HCHO odor on nose hairs. Hair will be stiff from HCHO, formaldehyde. Need a mirror by the prep room to check yourself before seeing a family or receiving other business guests. Environmental. Create a clean, sanitary body. Bathing and external disinfection of body is an agent, usually chemical, applied to inanimate object surfaces to destroy disease-causing microbial agents, but usually not bacterial spores. That's bathing and external disinfection, usually not bacterial spores. Disinfection of all external orifices of body. Use dish spray on all orifices. The use of internally disinfecting embalming chemicals will be vascular or cavity. Vascular and cavity. Thorough diffusion distribution to all tissues through the capillary walls. Movement of particles from an area of greater density to an area of lesser concentration. Diffusion. Distribution, then diffusion. Use adequate quantity. Multi-site injection, usually not more than 6 point. Maybe split injection drainage point. Adequate quantity of chemical, 1 gallon per 50 pounds of body weight, generally 2.5 index. Note, obese bodies will not have a volume of blood significantly more than the average sized person. Since one of the objectives of embalming is to replace all of the blood with embalming fluid, the embalmer of an extremely obese body is not going to apply the 1 gallon per 50 pound body weight to that body. This would mean that a 600 pound body would require 12 gallons of fluid. In this case, the embalmer would most likely use 3 gallons of fluid with a higher index of fluid employed. Example, 6 bottles of fluid rather than 3 to create a primary dilution sufficient to overcome the secondary dilution by the excessive water in the extremely obese case. Closure of all external orifices is not absolute. If purging, then pack. Might use AV plug. Packing, cotton or plug, as necessary, not automatic. Suture will turn down in like in the belly button. Pull tight, pull on the line of the incision. Put starting knot down inside the incision. Circular openings, use in-stitch or purse string suture. Use small, fine sutures. Adhesives. Adhesives, they do work, known as Aran Alpha, crazy glue. Might use on a clavicle incision. Make sure skin is dry before application. Environment, proper disposition of clothing. Launder and return to family. Destroy after proper authorization. Get authorization even if just PJs or housecoat. Proper disposal of all waste materials from the embalming procedure. Sharps get placed in sharps container. Sharps are hypodermic needles, suture needles, injector needles, scalpel blades, razor blades, pins, and other items sharp enough to cause percutaneous injury. Penetration of unbroken skin may include other items not normally disposed of following use, such as scissors, teeth, fingernails, and ribs are all sharps. Container. OSHA sharps container is an OSHA required receptacle for proper disposal of sharps. The ribs don't go and the teeth don't go in the sharps container. The sentences run together. Sharps container is an OSHA required receptacle for proper disposal. Biohazardous waste is biological agent or condition that constitutes a hazard to humans. Body and body fluids qualify as biohazardous waste. Bandages and cotton may be referred to as adhesive compresses. Strict compliance with all local, state, and federal OSHA regulations. All three must be followed. If they deviate, use the strictest version. Types of disinfection. Primary disinfection is disinfection carried out prior to the embalming process. Spray and wash. Concurrent disinfection is disinfection practice carried out during the embalming process. Instruments, when finished, are placed in the instrument tray and disinfected using glutaraldehyde. Terminal disinfection is an institution of disinfection and decontamination measures after the preparation of remains. Machines, instruments, and equipment. Make sure to clean, disinfect everything in the room is terminal disinfection. Preparation room, clean the entire room, including the ceiling, after a body is removed. Clean the ceiling, guys. Never know when you might have a Quentin Tarantino episode and blood just geysers up into the ceiling. Okay, I'm done. All right. U.S. Department of Labor OSHA rules. General duty clause. Each employer shall furnish to each of his employees employment and a place of employment which are free from recognized hazards that are causing or are likely to cause death or serious physical harm to employees. Hazardous communication standard. OSHA regulation that deals with identifying and limiting exposure to occupational hazards. They must have an MSDS, material safety data sheet, 2 copies, one in the prep room and one in the office. Hazardous material labeling, an agent or material exposing one to risk. Anything and everything in the prep room must be labeled. Employee information and training. Documentation of 1, 2, and 3 must document everything that happens. Formaldehyde rule. OSHA 29 CFR 1910-1048 is an OSHA regulation. An OSHA regulation limiting the amount of occupation exposure to formaldehyde gas. Formaldehyde is colorless, strong-smelling gas that when used in solution is a powerful preservative and disinfectant, a potential occupational carcinogen, medical surveillance, potential health hazards, and acute effects. Ingestion, swallowing of formaldehyde causes throat irritation. It's highly poisonous and will cause death. Inhalation, breathing, irritates the upper respiratory with inflammation to the nose, throat, and lungs. Skin, dermal, causes drying, cracking, and scaling dermatitis and skin sensitization. Chronic effects. Carcinogenicity, potential cancer in human lung, nasopharynx, and nasal passages. Toxicity may result in respiratory impairment such as asthma and bronchitis. Mutagenicity, genotoxic in several in vitro tests showing properties of mutation. So formaldehyde will turn us into Teenage Mutant Ninja Turtles. Okay. Signs and symptoms. Irritation of the mucosa of the eyes, nose, and throat. Above 0.1 parts per million, ppm. At 100 ppm, immediately dangerous to life and health. Swelling of the eyelids, respiratory disorders, coughing, shortness of breath, allergic reactions, frequent headaches, dizziness and drowsiness, jaundice, and bruising easily. Signs and symptoms of formaldehyde toxicity. Employee reporting. Employee must report to employer with any signs or symptoms of potential overexposure. Employee must be annually offered a medical disease questionnaire for a physician's review. These procedures are to be followed even if tested level is below PEL and STEL limits. Permissible exposure limit is PEL. The maximum legal limits established by OSHA for regulated substances. These are based on employee exposures that are time weighted over an 8-hour work shift. PEL is over an 8-hour work shift. When these limits are exceeded, employees must take proper steps to reduce employee exposure. For formaldehyde, the PEL is 0.75 ppm. Short-term exposure limit, STEL, is the legal limits established by OSHA to which workers can be exposed continuously for a short period of time without damage or injury. Exposures at the STEL should not be for more than 15 minutes and not repeated more than 4 times per work day. PEL, permissible exposure limit, PEL, 8-hour period, 0.75 ppm, PEL, 8-hour, 0.75 ppm. STEL, 15 minutes and not more than 4 times per day. TWA, time-weighted average, is an evaluation of exposures that is time-weighted over an established period. It allows the exposure levels to be averaged generally over an 8-hour time period. Medical removal protection. Employees who suffer significant adverse effects from formaldehyde exposure must be removed to jobs with less exposure until their condition improves. Employee benefits can continue for up to 6 months or until physician determines employee will not ever be able to return. Not only applies to formaldehyde gas. This not only applies to formaldehyde gas, it also applies to formaldehyde gas solutions, paraformaldehyde, and solids and mixtures containing HCHO known as a line formula. Exposure limits and monitoring. The initial exposure. To identify all employees who are exposed above action level or STEL, to accurately determine exposure of each employee. Further monitoring is unnecessary if exposure level is maintained below STEL and action level. To maintain records, annual monitoring is recommended. Employer must promptly monitor employee exposure upon receiving reports of formaldehyde-related signs and symptoms. Methods of compliance. Specific requirements. By OSHA, the prep room must have an eye wash station. A quick drench shower is an OSHA-required safety device for a release of a copious amount of water in a short time. Record keeping and exposure determination by monitoring. Controls to reduce exposure levels. These are OSHA recommendations only, not requirements. The following: adequate air exchange, exhaust ventilation. You would think that that would be fucking required. I said I was just going to read this. Wow. Adequate air exchange, exhaust ventilation is a recommendation, not a requirement. So just, fuck our lungs, I guess. Prevent spills. Cap all bottles. Rinse emptied fluid bottles. Place lid on embalming machine reservoir. Continuous aspiration of cavity during injection of autopsied bodies. Clamp all arteries and veins cut during autopsy to minimize volume. Clamp drainage veins as soon as blood has cleared to limit volume. Less HCHO to become airborne, higher intravascular pressure, and minimizes chemicals in the waste system. In the embalming of entire body, control drainage by using closed system from vein to disposal system. Do not allow drainage to run over body or on the table. Okay. Cover sink opening, waste receptacle. Table water should run continuously to dilute and wash away any chemical and blood drainage from body and table. Check hoses on injection machines to avoid leakage and spray. Keep lid on hazardous waste containers. Personal protective equipment, PPE, is those items of protection worn to minimize exposure to hazards. Those items worn by the embalmer to avoid contact with blood and other body fluids. Purpose of PPE. Selection. List all items to be worn. According to this standard, employees exposed to solutions 1% or greater are required to wear goggles and or face shield for protection of eyes and skin. Proper use and fit. Maintenance. Disposable items, launderable items, torn items. Housekeeping. Neutralize and clean spills immediately. Label covered disposal container. Use of red bags for hazardous waste. Consult local hazardous waste disposal regulations. Annual training of employees is required. Bloodborne pathogen standard, OSHA 29 CFR 1910.1030. Whatever the fuck that is. This is about that though. Exposure control plan. Schedule and method of implementation. Methods of compliance. HBV immunization. A severe infectious bloodborne virus. Inflammation of the liver. It may be caused by a variety of agents, including viral infections, bacterial invasion, and physical or chemical agents. Fever, jaundice, and an enlarged liver usually accompany it. HBV. Post-exposure evaluation and follow-up, communication of hazards, record keeping. Exposure determination. List all tasks and procedures with potential exposure for each employee. Removal of bodies from place of death, embalming bodies, dressing and casketing, preparing unembalmed bodies for disposition, housekeeping, and make exposure determination without regard to use of PPEs. Epidemiology explanation. Epidemiology. Whatever. Modes of transmission. Symptoms of disease that embalmer can contact. Examples to include HIV, HBV, and OPIM, other possible infectious material. Reference examples: eating, drinking, smoking, applying cosmetics or lip balm, and handling contact lenses, prohibited in work areas. Gather instruments and supplies prior to working with contaminated gloves. All contaminated items are cleaned and sanitized. All procedures involving blood and other possible infectious material, OPIM, performed in such a manner as to minimize splashing, spraying, splattering. Aerosolization, to disperse as an aerosol, is what that means. Minute particles of blood and water become atomized and suspended in air when water under pressure meets the blood drainage or when flushing an uncovered flush sink. PPEs are those items of protection worn to minimize exposure to hazards, those items worn by the embalmer to avoid contact with blood and other body fluids. Purpose and selection. List items to be used for protection from entry of virus through mucous membranes of eye, nose, and lips. The embalmer is to wear mask, goggles, or glasses with side shields or chin-length face shield. But the HCHO rule, formaldehyde rule, requires both mask and goggles. If there is danger, formaldehyde may reach the eyes. Formaldehyde rule requires both masks and goggles. If there is danger, formaldehyde may reach the eyes. Proper use and maintenance. It's also part of purpose of PPEs, I guess. Specific embalming techniques. Closed drainage procedure during injection. Drainage is the discharge or withdrawal of blood, interstitial fluid, and embalming fluid from the body during vascular embalming, usually removed through a vein of the body. Injection is the act or instance of forcing a fluid into the vascular system or directly into tissues. System of drainage tube and hose to take drainage directly to disposition receptacle. System of drainage tube and hose to take drainage directly to disposition receptacle. Okay. A drain tube is a tubular instrument of varying diameter and shape, preferably with a plunger that is inserted into a vein to aid in drainage of blood and to restrict the exit of vascular embalming fluid. Drainage from the right atrium through chest wall with drainage aspirated from the thoracic cavity. Using this system, minimal or no blood is allowed to flow over body or table. Lay transparent shield between embalmer and any open drainage sites, and it will prevent splatter and aerosolization. Flexible or solid plastic materials can be used. Avoid high water pressure when water is used to flush blood from the embalming table. During embalming, during cleanup, avoid splatter and aerosolization. Avoid parenteral entry. Parenteral. Piercing mucous Jesus. Parenteral really screwed me up there. Piercing mucous membranes or the skin barrier through such events as needle sticks, human bites, cuts, and abrasions. Getting punctured. I guess parenteral. It looks just like the word parent with the E-R-A-L on the end. Parenteral. Parenteral is a fancy word for getting punctured. Be conscious of where scalpels and other sharp instruments are laid during embalming. Cover broken or cut bones prior to placement of embalmer's hands or arms into cavity or mutilated portion of body. Do not place gloved hand to mask or eye cover. Wash gloved hands often during embalming procedure to check for torn gloves. Avoid a contamination of environment. Housekeeping procedures and written schedule, cleaning and decontamination, regulated waste handling and disposal, contaminated laundry handling, containment, decontamination, hepatitis B immunization, emergency procedures, accident reporting, post-exposure evaluation, and label and sign explanation are all part of specific embalming techniques. New for OSHA as of January 1st, 2015. All employers must report all work-related fatalities within 8 hours. All work-related inpatient hospitalizations, all amputations, and all losses of an eye within 24 hours. The OSHA revised record-keeping rule includes 2 key changes. First, the rule updates the list of industries that are exempt from the requirement to routinely keep OSHA injury and illness records due to relatively low occupational injury and illness rates. Second, the rule expands the list of severe work-related injuries that all covered employees must report to OSHA. How are establishments located in state plan states affected by the new requirements? There are 27 states and U.S. territories that have their own OSHA-approved occupational safety and health programs called state plans. State plans are required to have standards that are at least as effective as OSHA's. At least as effective as OSHA's. All state plans have record-keeping and reporting requirements in place. These requirements are at least equivalent to OSHA's previous reporting requirements for fatalities and catastrophes. So states can be more strict than OSHA, but they can't be more lax than OSHA. In addition, several states have different or additional requirements that may already be in line with OSHA's revision. All state plans have begun reviewing their current reporting and record-keeping requirements to determine how they compare to OSHA's new reporting requirements. Dr. David Michaels discusses publication of the final rule for hazard communication. Exposure to hazardous chemicals is one of the most serious threats facing American works today. Revising OSHA's hazard communication standard will improve the quality and consistency of hazard information, making it safer for workers to do their jobs and easier for employers to stay competitive. The Hazard Communication Standard, HCS, is now aligned with the globally harmonized system of classification and labeling of chemicals, GHS. This update to the Hazard Communication Standard, HCS, will provide a common and coherent approach to classifying chemicals and communication hazard information on labels and safety data sheets, SDS. The revised standard will improve the quality and consistency of hazard information in the workplace, making it safer for workers by providing easily understandable information on appropriate handling and safe use of hazardous chemicals. This update will also help reduce trade barriers and result in productivity improvements for American businesses that regularly handle, store, and use hazardous chemicals while providing cost savings for American businesses that periodically update safety data sheets and labels for chemicals covered under the Hazard Communication Standard. OSHA Forms 300, 300A, and 301 are the OSHA forms for recording work-related injuries and illnesses and are used by employers to record work-related injuries and illnesses that result in death, loss of consciousness, days away for work, restricted work activity or job transfer, or medical treatment beyond first aid. The information provided by OSHA forms is an important asset for helping employers, workers, and the Occupational Safety and Health Administration evaluate the safety of a workplace, figure out possible industry hazards, and ensure worker protections to cut down and prevent hazards. OSHA forms include several parts. Form 300 is also called the Log of Work-Related Injuries and Illnesses. Form 300A, the yearly summary of total cases in each category. And Form 301, Injury and Illness Incident Report. Form 300 is important for classification of work-related injuries and illnesses. It also provides the information on the extent and severity of each case. When an accident occurs, the specific details about what happened and how it happened should be recorded in the log. There's definitely a typo there because he definitely wrote ho. You know, OSHAs and hoes. OSHA incident reports must be kept for 30 years from the date the incident occurred. OSHA incident reports must be kept for 30 years from the date the incident occurred. FTC rule. Scope of the rule. Permission to embalm. Embalming is not required by law, only in certain circumstances. Legal necessity is when someone died of a communicable disease, they're being transported across state lines, burials not taking place within 24 hours, and when having a public viewing when one of these things is going on makes it a legal necessity. Practical necessity, because of unembalmed communicable disease, body, and public visitation. The Federal Trade Commission, under the federal rule, has certain very specific compliance requirements pertaining to funeral service. The one that pertains to embalming is found in the requirements for the General Price List, or GPL. The GPL is the keystone of the funeral rule. The GPL, the General Price List, is the keystone of the funeral rule. I don't know why they say keystone. I think they mean cornerstone, something like that. Keystone. I guess we got to watch for that in case it pops up. It must contain identifying information, itemized prices for the various goods and services that are sold by the funeral home, and other important disclosures. The GPL enables consumers to comparison shop and to purchase on an itemized basis only the goods and services they want. Identifying information. The GPL should be printed or typewritten and must contain the following identifying information: the name, address, and telephone number of the funeral provider's place of business, including the address and telephone number for each branch where relevant. The caption, general price list at the top, the title, general price list, and the effective date of the price list. Required disclosures on the GPL. The rule also requires the funeral director to make 6 disclosures on the GPL. 6 disclosures on the GPL. 1, the consumer's right to select only the goods and services desired. 2, embalming. 3, alternative containers for direct cremation. 4, the basic services fee. 5, the casket price list. And 6, the outer burial container price list. I'm going to repeat that. The funeral rule requires the funeral director to make 6 disclosures on the GPL. 6 disclosures on the GPL. 1, the consumer's right to select only goods and services desired. 2, embalming. 3, alternative containers for direct cremation. 4, the basic services fee. 5, the casket price list. 6, the outer burial container price list. Embalming. With embalming, the second disclosure tells consumers that the law does not require embalming. The statement should read as follows: except in certain special cases, embalming is not required by law. Embalming may be necessary, however, if you select certain funeral arrangements, such as a funeral with a viewing. If you do not want embalming, you usually have the right to choose an arrangement that does not require you to pay for it, such as direct cremation or immediate burial. That's what the embalming disclosure is supposed to say. Next section, death. Death is defined as the irreversible cessation of all vital functions. That's the non-legal definition. Actually, non-legal definition is the irreversible cessation of all vital functions, or irreversible total cessation of metabolic activity. Here are some terms associated with death. Moribund, which means agonal period also. Moribund, agonal period. In a dying state, in the agonal period. This is the period immediately before somatic death. It means headed towards death. The death rattle is the noise made by a moribund person in the agonal state, caused by air passing through a residue of mucus in the trachea and posterior oral cavity, which is the pharynx. Death struggle is the term that means semi-convulsive twitches that often occur before death. Death struggle. Cadaveric spasm, a prolongation of the last violent contraction of muscles into the rigidity of death. So cadaveric spasm is different than death struggle. Death struggle, semi-convulsive twitches that often occur before death. Cadaveric spasm, a prolongation of the last violent contraction of muscles into the rigidity of death. Apparent death means condition in which the manifestations of life are feebly maintained, very faint. Apparent death. Manifestations of life are feebly maintained, very faint. So death has become apparent, but hasn't quite happened yet. It's just shown its face, I guess, you can see it, but it hasn't happened yet. Apparent death. Human remains is the body of a deceased person, including cremated remains. Cadaver is a dead human body. Cadaver is a dead human body used for medical purposes, including transplantation, anatomical dissection, and study. This is a legal term, means also donated to science. Do not ever use this term at the funeral home. We do not deal with cadavers. Cremated human remains. Use this term when referring to them at the funeral home. Those elements, it's defined as those elements remaining after cremation of a dead human body. Cannot trash them. You must wait for the family to give specific directions for final disposition. Thanatology means the study of death. Types of death. Note, AIDS can hide in all tissues of the dead body. AIDS can hide in all tissues of the dead body and may survive up to 20 hours. Somatic death is the death of the organism as a whole. Body is dead, but not the cells. Somatic death is death of the organism as a whole. The body is dead, but not the cells. Legal, clinical death is a phase of somatic death lasting from 5 to 6 minutes in which life may be restored. Not irreversible, may resuscitate. The tripod of life is the heart, the lungs, and the brain. Any one stops and you die. Not dead until warm and dead. Cold dead may be revived. So that sounds important. Tripod of life, heart, lungs, and brain. Anyone stops and you die. But you're not dead until you're warm and dead. Cold and dead, you may be revived. Biological, irreversible death. This is irreversible somatic death. Biological death means irreversible somatic death. Cellular death is the death of the individual cells of the body. The cells may stop functioning after 10 to 20 hours. It varies. Cellular death always follows somatic death. So somatic death happens first, and then cellular death happens after. Cells may stop functioning as long as after 10 to 20 hours. Antemortem means before death. Necrosis means pathological death of a while lack of O2 to cells. Something's funny about the way that's written. Necrosis, pathological death of a while lack of O2 to cells. I think while wasn't supposed to be there. I think necrosis is pathological death due to lack of oxygen to cells. Necrosis. Decubitus ulcers are bed sores and also called pressure sores. Decubitus ulcers are also called bed sores, also called pressure sores. They are caused by pressure to capillaries from staying in bed on a hard surface and cutting off blood flow to outer cells of the body. Gangrene is necrosis, death of tissues of part of the body, usually due to deficient or absent blood supply. And there's 3 types of gangrene: wet, dry, and gas. Necrobiosis, it means death/life, I guess. Necrobiosis. Antemortem, physiological death of the cells of the body, followed by their replacement with living tissue. Okay. It says necrobiosis, death/life. Antemortem, physiological death of the cells of the body, followed by their replacement with living tissue, is necrobiosis. Post-mortem, period that begins after somatic death. Post-mortem is a period that begins after somatic death. Death of the organism as a whole is somatic death. Factors influencing onset of post-mortem cellular death. Death of the individual cells of the body occurs about 20 hours after somatic death. Death of the individual cells of the body occurs about 20 hours after somatic death. Cause of death, environmental conditions. Hot and moist conditions are the worst possible. Hot and moist. Condition of the body, obesity or lack thereof. Corpulence is a word for abnormal amount of body fat. Corpulence, abnormal amount of body fat. Amount of clothing could also prevent vermin from eating flesh. What? Medication preceding death. This is all stuff that has to do with the period that begins after somatic death and post-mortem. Signs of death. This sounds important. Signs of death. Decomposition is the number 1 sign. Decomposition, advanced. Single best way to tell if someone is dead: odor and maggots. Number 2, cessation of circulation. Check with a stethoscope, pulse, or livor mortis. 3, cessation of respiration. Mirror test under nose is a poor test to check for cessation of respiration. The mirror test under the nose is a poor test. 4, complete muscular relaxation. The dead body can rest in position impossible for a living person. Algor mortis, the cooling down, this varies with conditions, cools to ambient temperature. Rigor mortis, post-mortem stiffening of the body muscles by natural body processes. Rigor mortis onset is after 4 to 6 hours, lasts from about 4 to 6 hours and up to 24 hours. This greatly varies with conditions. A buffer will neutralize rigor mortis and is recommended open drainage and no preservative. Rigor mortis is caused by calcium ions neutralizing myosin and actosin so that the muscles lock up. Livor mortis. Number 7, livor mortis, cadaveric lividity. Livor mortis is also called cadaveric lividity. Post-mortem intravascular red-blue discoloration resulting from hypostasis of blood. Another sign of death. Clean out with arterial injection. If black, probably extravascular stains. Number 8, changes of the eye. Clouding of cornea occurs almost immediately after death. Loss of luster of conjunctiva, which is the mucous membrane that lines the eyelid and covers the white portion of the eye. It's like a saran wrap cover. It turns gray at death. Flattening of eyeball. Approximately 4 hours after death, this is caused by a loss of pressure in the eye. It causes the bump on the eyelid and smooths out the wrinkles on the lid. Pupil dilation, non-response to light, occurs almost immediately. Tests for death is any procedure used to prove a sign of death. Manifestation of death in the body. Sign of death, manifestation of death in the body. Signs are objective, symptoms are subjective. Let me say that again. Signs of death are objective. Symptoms of death are subjective. So that means signs are good. Symptoms are like a matter of opinion. Cannot use subjective. If they could tell us how they felt when dead, we wouldn't be worried about whether or not they were dead. Expert tests are done by physicians only in most states, and that is any procedure used to prove a sign of death, usually performed by medical personnel, not done at the scene of death usually. Stethoscope. Delicate instrument used to detect almost inaudible sounds produced in the body and audible heart sounds. Ophthalmoscope. Ophthalmoscope. It's spelled OPHTH. OPHTH. Ophthalmoscope. That's the thing that looks in the eye or ear for pupil response and retina blood flow. Injections of various dyes into the body to test for circulation is not generally done now. Electronic life detection devices is an encephalogram. Electronic life detection devices is an encephalogram. The inexpert tests or non-expert tests historically was the ligature test. They would ligate a finger, and if it becomes discolored and swells, then life is present. Ammonia injection test. Ammonia injected hypodermically into the skin will show reddish reaction if the body is alive. But this is not conclusive. You might get that reaction also even if the person is dead. So poo-poo on the ammonia injection test. Feel for a pulse at the radial artery. If any pulse is perceptible, the body is alive. Those are inexpert historical tests. Pre-embalming changes. Antemortem agonal changes are those changes occurring in the interval prior to somatic death. Thermal changes includes agonal algar and agonal fever. Agonal algar is a decrease in body temperature immediately before death. It's cooling. The larger the body, the slower it cools. The larger the body, the slower it cools. This is caused by decreased circulation and is fairly typical. Agonal fever increases in body temperature immediately before death, may be caused by a full stomach also. Blood changes. Hypostasis is the settling of blood and or other fluids to dependent portions of the body. That's hypostasis. Congealing or coagulation is the process of converting soluble protein to insoluble protein by heating or contact with a chemical such as alcohol or an aldehyde. The solidification of a solution, that it might also say SOL, into a gelatinous mass. Agglutination. Agglutination. Agglutination is a specific form of coagulation. Agglutination. I just try to remember glutinous, I guess. I don't know. Agglutination is intravascular. It's the increase of viscosity of blood brought about by the clumping of particulate formed elements in the blood vessels. Moisture changes means edema. Abnormal accumulation of fluids in tissue or body cavities is edema. It creates moisture changes. Other moisture changes are agonal edema and agonal dehydration. Agonal edema is escape of blood serum from an intravascular to an extravascular location immediately before death. Agonal dehydration is the loss of moisture from the living body during the agonal state. Bacterial translocation from intestinal areas to blood vascular system due to capillary permeability changes is translocation. An agonal or post-mortem redistribution of host microflora on a host-wide basis. Bacterial translocation from intestinal areas to blood vascular system due to capillary permeability changes. Translocation. An agonal or post-mortem redistribution of host microflora on a host-wide basis. Gases in the tissues. Could be antemortem subcutaneous emphysema. It's before death under the skin. Cells expand, stretched out of shape. May be caused by respirator pumping air into body. Air edema or hospital-induced edema is antemortem subcutaneous emphysema. Gas gangrene. That is necrosis in a wound infected by an anaerobic gas-forming bacillus. The most common etiologic agent being Clostridium perfringens, Clostridium welchii, or Welchii bacillus. Wet gangrene something. The document's messed up. I can't see that word. Dry gangrene is the condition that results when the body part that dies had little blood and remains aseptic. The arteries, but not the veins, are obstructed, shrivels up. Wet gangrene is necrotic tissue that is moist as a result of inadequate venous drainage and may be accompanied by bacterial infection. It swells up and turns black. With bacteria, usually will get gas gangrene. Post-mortem is called tissue gas. Therapeutic agents. On test, these will be clustered. Therapeutic agents like chemotherapeutic agents, blood thinner, antibiotics, and vasodilators. The chemotherapeutic agents are application of chemical reagents in the treatment of disease, generally causes an elevated preservative demand. Almost all chemotherapeutic agents have nitrogen, may use disan or trisan for last gallon to firm up. Blood thinner prevents clotting, like aspirin is a blood thinner. It makes it easier to remove blood. Antibiotics don't harm the embalming operation. Body produces things in response to fight infections. Vasodilators dilate the vessels and aids in distribution, but the caution is that swelling could accompany with edema the vasodilators. Post-mortem changes. Physical changes. Algor mortis is post-mortem cooling of the body to the surrounding temperature is algor mortis, post-mortem cooling of the body to surrounding temperature. Intrinsic factors are from within the body. That means from within the body. Corpulence means obesity, having an abnormal amount of fat on the body. And this slows down cooling. You'd think it'd be warmer, but it slows down cooling. A skinny person has more surface area per pound than a corpulent person does. Age is also whatever. Extrinsic factors are from outside the body. Amount of clothing covering the body, more clothes, slower cooling. Temperature and humidity of the environment. Temperature of the patient at death, that should be intrinsic. Okay, I guess there was a boo-boo in the notes. Temperature of patient at death should be intrinsic, not extrinsic. Cause and manner of death can be both extrinsic and intrinsic. The cause of death is what killed you, what made the oxygen stop going to cells. The manner of death is how did it get there, which is like suicide, homicide, or accidental. Hypostasis is the settling of blood and or other fluids to dependent lower portions of the body. Livor mortis is cadaveric lividity, post-mortem intravascular red-blue discoloration resulting from hypostasis of blood pooling by gravity. Dehydration is also called desiccation. That's loss of moisture from body tissue, which may occur antemortem or postmortem. Antemortem is like febrile disease, diarrhea, or emesis. Postmortem, injection of embalming solution or through absorption by the air cause dehydration or desiccation. It's the process of drying out done intentionally. Surface evaporation is dehydration known as surface evaporation, desiccation all the way through. Imbibition, postmortem edema. Imbibition is postmortem edema. Absorption of the fluid portion of blood by the tissues after death, resulting in postmortem edema. Gravitation of serum is where liquid flows to dependent lower portions of the body. Increase in viscosity of blood has a few points to it. Increase in viscosity of blood, imbibition, absorption of the fluid portion of blood by the tissues after death, resulting in postmortem edema, increases viscosity. Imbibition, gravitation, increases viscosity. Agglutination increases viscosity. Agglutination of formed elements. Intravascular, the increase of viscosity of blood brought about by the clumping of particulate formed elements in the blood vessels. Chemical changes, decomposition, the types of decomposition. Autolysis is the self-destruction of cells, decomposition of tissue by enzymes of their own formation without microbial assistance. Autolysis is us eating ourselves. Role of lysosomes, organelle that exists within a cell but separate from the cell. Contains hydrolytic enzymes that break down proteins and certain carbohydrates. Where enzymes stay during life. Autolysis occurs when enzymes break out. Enzyme is an organic catalyst produced by living cells and capable of autolytic decomposition. Fermentation is bacterial decomposition of carbohydrates which break down sugars. Saccharolysis is decomposition of sugars. Proteolysis is decomposition of proteins. Putrefaction is decomposition of proteins by the action of enzymes from anaerobic bacteria. Anaerobic decomposition, no air to skin as in underwater, more odor than with decay. Decay is decomposition of proteins by enzymes of aerobic bacteria, also called aerobic decomposition. Decay is aerobic, putrefaction is anaerobic. Lipolysis is decomposition of fats. Hydrolysis is a reaction in which water is one of the reactants and compounds are often broken down. In the hydrolysis of proteins, the addition of water accompanied by action of enzymes results in the breakdown of protein into amino acids. Split by taking up elements of water. Breaks down proteins, amino acids, which are connected by peptide bonds. Final decomposition products are CO2, H2O, and nitrogen compounds like ammonia, urea, and energy. Amino acid, building blocks of which proteins are constructed, and the end products of protein digestion or hydrolysis. Their basic formula is NH2-CHR-COOH, an amino group, an alpha carbon, any aliphatic or aromatic radical, and a carboxyl group. Signs of decomposition: color, pasty white surface, liver mortis. Its color is what they call a number 2 sign. Number 2 sign. Number 1 sign of decomposition is odor. Another one is purge, which is the post-mortem evacuation of any substance from an external orifice of the body as a result of gas pressure. Desquamation, also called skin slip. Sloughing off of the epidermis, wherein there is a separation of the epidermis from the underlying dermis. Accumulation of gas in viscera, cavities, and other body tissues, which causes purge. Bodies bloat as a result of the gas buildup. Sign of decomposition. Products of decomposition. Products of decomposition are amino acids, which are the building blocks of which proteins are constructed, and the end products of protein digestion or hydrolysis. Their basic formula is NH2-CHR-COOH. An amino group, an alpha carbon, any aliphatic or aromatic radical, and a carboxyl group. Amino acids are a result of decomposition of proteins. Then there are fatty acids. Fatty acids are a product of decomposition of fats, decomposition of lipids. 3-carbon trihydroxyalcohol equals glycerol. Fatty acid is 16 to over 18 carbons long, breaks apart by hydrolysis, hydrolyze fats, and will get 3 molecules of fatty acids, 1 molecule of glycerol, and 1 molecule of fatty acid. Glycerol is slimy and slippery. Ptomaines, I think the P is silent, Ptomaines. Scatole, indole, cadaverine, and putrescine is ptomaines. Any one of a group of nitrogenous organic compounds formed by the action of putrefactive bacteria on proteins. Ptomaine poisoning equals microorganisms like E. coli or Staphylococcus. Microorganisms like that cause to be sick. There are 20 to 22 essential amino acids that differ because of the difference in side chain configuration. The simplest one is glycine. Some are ptomaines. End products of decomposition is ammonia, ammonium compounds, hydrogen sulfide, which stinks, mercaptans, which are sulfur-containing compounds, nitrogen, carbon dioxide, water, methane, phosphoric acid, and sulfuric acid. Factors governing decomposition. There are intrinsic factors which are inherent to the body, which is age, sex, corpulence or obesity, abnormal amount of body fat, cause and manner of death like suicide, homicide, or accidental, bacterial and parasitic activity, normal inhabitants of the body, pharmaceutical agents, drugs or medicines, probably retard decomposition. Those were intrinsic. The extrinsic or external factors outside the body governing decomposition is the air. Is it hot or cold? The moisture. Is it wet or dry? Hot and wet are worst possible conditions for the body. Temperature, minimum 32 degrees Fahrenheit, optimum 98 degrees Fahrenheit to 100 degrees Fahrenheit, which is body temperature. Maximum 120 degrees Fahrenheit, which stops most decomposition. Bacterial and parasitic activity from outside the body. Pressure due to earth or closing. If tissue squeezed or flattened, it won't decompose. If tissue is squeezed or flattened, it won't decompose. So pressure due to earth or clothing. Vermin, including maggots, lice, and rats. Also coyotes, fish, cats, wolves, etc. Order of decomposition of the body compounds. The first thing to decompose is carbohydrates. The second thing to decompose is proteins. The third thing to decompose is fats. The fourth thing to decompose is bones. Order of decomposition of the body compounds. First is carbohydrates, a compound of hydrogen, carbon, and oxygen, so sugars, starches, and glycogen. Then proteins, which is an organic compound found in plants and animals and can be broken down into amino acids. Then the fats, which are organic compound containing carbon, hydrogen, and oxygen. Chemically, a triglyceride ester composed of glycerol and fatty acids. Then the bones. The order of putrefaction of the organs or viscera. Putrefaction is decomposition of proteins by the action of enzymes from anaerobic bacteria. In other words, no air. Putrefaction. First order of putrefaction is the lining membrane of the trachea and the larynx. First is the lining membrane of the trachea and the larynx, except for the brain of an infant and the pregnant uterus, which will decompose faster due to high water content. So lining of sorry. So first is lining membrane of the trachea and the larynx, except for the brain of an infant and the pregnant uterus, which decomposes faster due to high water content. The last is the non-pregnant uterus or large blood vessels in the male and female. Change in the pH of the body, which is the degree of acidity or alkalinity. The scale ranges from 0 to 14, 0 being completely acid and 14 completely basic and 7 neutral. Blood has a pH of 7.35 to 7.45. Negative log of hydrogen ions, 10 to the X. I don't know what that means. During life, the normal pH of blood and tissue is approximately 7.35 to 7.45, about 7.4. During rigor mortis, the pH may be as low as 5 or 6, which is very acidic. Rigor mortis is the post-mortem stiffening of the body muscles by natural body processes. During advanced decomposition, the pH returns to the alkaline register, may go up to 11 on the scale. Ammonium hydroxide. I guess that has something to do with pH returning alkaline. Rigor mortis for the 100th time is the post-mortem stiffening of the body muscles by natural body processes. You can inject certain chemicals to neutralize rigor mortis. Conditions affecting onset, duration, and termination of rigor mortis is the temperature. It's the same range as affects decomposition. Minimum 32 degrees. Optimum 98 degrees Fahrenheit to 100 degrees Fahrenheit or normal body temperature. Maximum is 120 degrees Fahrenheit. Age. Very young or old don't have as much muscle mass, so don't go to extremes. Sex, pregnancy, you get more rigor mortis. I don't know what that means. Sex, in parentheses, pregnancy, you get more rigor mortis. Cause of death, actually circumstances of death, anticipation of pain or death can cause adrenaline to lock up muscles into a spasm that won't unlock after death. Condition of muscles, most important factor influencing rigor mortis. The stronger a person is, it makes the rigor mortis worse. Order of appearance and disappearance with rigor mortis. Begins at eyes and works out. Leaves in same order. Physical methods of reducing rigor mortis. Move the limbs and body parts to break loose rigor. By flexing, extending, rotating, massaging the face and flat areas of the body. Post-mortem stain is the extravascular color change that occurs when hemoglobin, released by hemolysis of red blood cells, seeps through the vessel walls and into the body tissues. Post-mortem stain cannot be removed during normal arterial injection and venous drainage. If you press on the skin and get a white spot that goes away, it's livor mortis, not post-mortem stain. Use bleaching packs and hypodermic injection to remove. If it's not visible, don't worry about it. Post-mortem caloricity is the rise in temperature after death due to continued cellular metabolism. It is usually found in cases of sudden death. Heat is continually produced after death by the metabolism of the food products and tissues. The various methods of cooling the body, such as circulation, have ceased. Therefore, heat accumulates and the body temperature rises. Doesn't always happen, but it can. Orientation, to do with equipment. Pressure machines are centrifugal force machines. It's the embalming machine that uses an electrical pump to create pressure, either pulsating or non-pulsating. The three main companies are Portaboy, Duotronic, and Sawyer. Centrifugal force machine called pressure machines. Hydroaspirator is an apparatus that is connected to the water supply. When the water is turned on, a suction is developed and is used to aspirate the contents of the body cavities. Electric aspirator is a device that uses a motor to create suction for the purpose of aspiration. If you let the aspirator run dry, it will seize up. Gravity injector is an apparatus used to inject arterial fluid during the vascular or arterial phase of the embalming process. It relies on gravity to create the pressure required to deliver the fluid. 0.43 pounds of pressure per 1 foot of elevation. 0.43 pounds of pressure per 1 foot of elevation, or half pound every 14 inches, or half pound every 14 inches. Hang it from the ceiling. So it says. Hand pump is a historical thing. It's a historical instrument resembling a large hypodermic syringe attached to a bottle apparatus. It's used to create either pressure for injection or vacuum for aspiration. A bulb syringe is another historical thing. Self-contained soft rubber manual pump designed to create pressure to deliver fluid as it passes through one-way valves located within the bulb. It is used only to deliver fluids. It cannot be used for aspiration. Electric spatula. An electrically heated blade which may be used to dry moist tissue, reduce swollen tissue, and restore contour. May also puff up dehydrated lips. Use liberal amounts of massage cream on surface to prevent blistering. If you keep your gloved hand near the blade, it gets too hot for your hand. And if it's too hot for your hand, it's too hot for the skin of the body. A hair dryer. Equipment used to dry the hair of the deceased and is made specifically for mortuary use. Don't use full head dryer. Use curling iron instead or handheld hair dryer. Keep hand in airflow to judge heat to prevent burns on the remains. Hair dryer can also be used to dry wet clothes. Body lifts are designed to eliminate the physical strain of moving caskets and bodies by hand. Sterilizers, also known as chemical or heat pressure, or example, chemical heat pressure sterilizer, my bad. Oven or appliance for sterilizing, an autoclave that disinfects by steam under pressure at temperatures above 100 degrees Celsius. Also concurrent disinfection tray, a sani tray. Impermeable position devices is preparation room equipment for properly positioning bodies prior to, during, and after vascular embalming. Examples are headrests, armrests, shoulder rests, and footrests. Tables. With the tables, note, may have combination embalming dressing table. An embalming table is a table that human remains are placed for the purpose of embalming. A dressing table is for the dressing of the deceased. It does not tilt. It has no drain or folds in the middle. Refrigeration units should be maintained between 38 degrees and 40 degrees Fahrenheit. Eye wash equipment station, OSHA required emergency safety device providing a steady stream of water for flushing the eye. Quick drench shower. OSHA required safety device for a release of copious amounts of water in a short time. Sharps container is an OSHA required receptacle for proper disposal of sharps. Biohazardous waste container is an OSHA required container used for biohazardous waste. Exhaust system exhausts air out of the room. OSHA requires air to be replaced at least 6 times per hour. PPE, those items of protection worn to minimize exposure to hazards. Those items worn by the embalmer to avoid contact with blood and other body fluids. Specialized plumbing. Water pressure is important for the hydroaspirator, positive flow water system. Instruments. We're finally to instruments. I'm sure this is important. That's the last time I'm going to say that. Carrying on. Arterial tubes. A tube used to inject embalming fluid into the blood vascular system. There's straight, there's hairpin, and there's curve. Arterial tubes injects embalming fluid into the vascular system. Needle injector, a mechanical device used to impel specifically designed metal pins into bone. Needle injector, the thing that you use to hammer the wire into the jawbone to close the mouth. But the stupid definition is a mechanical device used to impel specifically designed metal pins into bone. Needle injector. Scalpel. An embalming instrument consisting of a handle and blade fused together as one unit and used to make incisions. When the blade becomes dull, the entire instrument is disposed of, no changing of blades. Scalpel, 1 unit. Scalpel, 1 unit. It's the bistoury knife that's 2 pieces. Scalpel is 1 unit, bistoury is 2. Aneurysm, hook, or needle. An embalming instrument that is used for blunt dissection and in raising vessels. The aneurysm needle has an eye in the hook portion of the instrument for placing ligatures around the vessel. Aneurysm hook or needle has the eye and hook that you put the ligature through. Aneurysm hook or needle has the eye for the ligature. Scissors may be sharp, blunt, blunt, or bandage scissors. May be straight or curved. Groove director. Instrument used to guide vein tubes into vessels. Separator or bone separator is an instrument used to maintain the elevation of the vessels above the surface of the skin. Currently made out of plastic or wood. Separator, bone separator. Maintains elevation of vessels above skin made out of plastic or wood. Hemostats or locking forceps. Hemostats or locking forceps are embalming instruments used to clamp vessels. In various sizes, can be straight or curved. Hemostats, locking forceps, clamps vessels, straight or curved. Spring forceps, multi-purpose instrument commonly used for holding cotton swabs, wiping out and disinfecting the eyes, restoration treatment, and closing the eyes. Also may hold open veins. Spring forceps, multi-purpose, used for holding cotton swabs, wiping out, disinfecting eyes, restoration treatments, and closing the eyes, may also hold open veins. Retractors or spreaders. Spreaders are general purpose instruments which are primarily used to spread incisions and to afford more working room. Razor, used to shave both male and female cases. Use good quality razors and blades. Drain tube is a tubular instrument of varying diameter and shape, preferably with a plunger, that is inserted into a vein to aid in drainage of blood and to restrict the exit of vascular embalming fluid. Stopcock, used on arterial tubes to stop the flow of fluid. Stopcocks, used on arterial tubes to stop the flow of fluid. Suture needles, used to close cuts and incisions by suturing with ligature. Suture needles, close cuts and incisions by suturing with ligature. Nasal tube aspirator, used to aspirate the throat by means of the nostrils. Nasal tube aspirator aspirates the throat by means of nostrils. Autopsy aspirator, used to aspirate the body cavity after a post-mortem examination has occurred. Trocars, sharply pointed surgical instrument used in cavity embalming to aspirate the cavities and inject cavity fluid. The trocar may also be used for supplemental hypodermic embalming and come in various sizes. Hypodermic syringe and needle, used to inject embalming chemicals and tissue builder into the body tissues. Trocar button applicator, used to insert trocar buttons into trocar punctures created when the trocar is inserted into the body. Arterial fixation forceps, purpose is to hold arterial tubes in the arteries. Next section, supplies. Preservative embalming chemicals, or preservative, is chemicals which inactivate saprophytic bacteria, render unsuitable for nutrition the media upon which bacteria thrive. What the fuck? There seems to be a typo. So preservative embalming chemicals, or just the word preservative, chemicals which inactivate saprophytic bacteria. It deactivates saprophytic bacteria. Okay. It renders the bacteria's, it says, render unsuitable for nutrition the media upon which such bacteria thrive. So the media upon which saprophytic bacteria thrives, preservatives render that media unsuitable for the bacteria's nutrition. That's what preservatives do. Okay. Glad I double checked that. Okay. And preservatives are also what will arrest decomposition by altering enzymes and lysins of the body, as well as converting the decomposable tissue to a form less susceptible to decomposition. Less susceptible to decomposition. Bleaches and bleaching agents are a chemical that lightens a skin discoloration. Disinfectant chemicals. Embalming chemicals that are used to destroy or inhibit most pathogenic bacteria and their products in or on the body, preparation room instruments, as well as the individual performing the embalming operation. Usually topical applications or surface applications. That's disinfectant chemicals, usually surface topical applications. Sealers, as in external and internal sealers, sealing agents are materials used to provide a barrier or seal against any type of leakage of fluid or blood. Comes in powder or liquid forms, external and internal use. That's sealers, external and internal. Disinfectant soaps is a must-have. Disinfectant soaps is a must-have. Prepidine is more potent than over-the-counter soaps. Antibacterial. Solvents, a liquid holding another substance in solution. Solvents is a liquid holding another substance in solution. A solvent is chemicals that are used in the preparation room to remove stains from the body, a cleanser for cosmetic brushes, and a spot remover and a thinning agent. Acetone is Dr. T's favorite solvent. Cotton is a supply that is used for cotton swabs as a padding material, etc. There are two different types used, a roll and a towel form, which is called web roll, or spelled like web reel, but everyone kind of says web roll. Tubing Tubing is what's used with the embalming machine, aspiration procedures, water hoses, etc. It is available in rubber and plastic form. Eye cap is a thin plastic dome-shaped disc used to restore contour just beneath the eyelids. Item that is placed between the eyelids and the eye of the deceased to keep the eyelids closed and to give them their natural contour. Trocar buttons is a plastic threaded screw-like device for sealing punctures and small round trocar openings. Mouth formers is a device used in the mouth in shaping the contour of the lips, used to support the lips and give the deceased's mouth a normal contour when the deceased does not have natural teeth or dentures. That seems to be important. It's in bold. The part about the mouth former gives the normal contour when the deceased does not have natural teeth or dentures. Plastic goods include unionals, coveralls, panties, stockings, etc. Duct tape and trash bags work well. That sounds creepy as shit. Duct tape and trash bags, alrighty. Make sure to use these when shipping because of pressure changes and bumpy rides. Powder first, always. Suture ligature is the type of ligature used with suturing needles to suture cuts and incisions. Injector needles are used in mouth closure. It is inserted into the needle injector and forced into the mandible and maxilla. It might also, I swear I've seen propelled and words like that. It's hammered into the freaking mandible and maxilla. Adhesive is super glue, Aran alpha, rubber cement, etc. Lip and lip cement or lid cement. It says lid cement. I don't know if they meant to put lip or if it's actually lid cement. Is used on cases where the lips and or eyelids are difficult to close properly. Use stay cream made of beeswax before going to adhesives. Preparation of the body. Embalming analysis, also called case analysis, is the consideration given to the dead body prior to, during, and after the embalming procedure is completed. Documentation is recommended. Planning, work outline. As soon as you see the body, you begin forming a plan of action for how you will embalm this particular body. Analysis is continuous throughout the process of embalming, and you may modify your plan due to based on how the body is responding to your actions. The purpose of the embalming analysis or case analysis is to prescribe and apply the proper embalming technique. There's a variety of quote, quote, variable factors encountered. Intrinsic factors include cause and manner of death and body conditions. All of these are intrinsic. The body conditions are pathological conditions, microbial influence, moisture, thermal influences like fever, nitrogenous waste products, which are metabolic byproducts that contain nitrogen, such as urea and uric acid. These compounds have a high affinity for formaldehyde and tend to neutralize embalming chemicals. Also, weight, corpulence, or emaciation. Corpulence is a fancy word for obesity. And gas in tissues or the cavity. So, body conditions are pathological, microbial, moisture, thermal, nitrogenous waste, weight, and gases in tissues or cavity. Those are body conditions. and part of the intrinsic factors with cause and manner of death. And also intrinsic factors is present or absence of discolorations, like totally exsanguinated, fancy word for out of blood, exsanguinated, totally out of blood, loss of blood to the point of not being able to support life. It leaves a person ghostly white. That is an intrinsic factor. Postmortem changes is an intrinsic factor also, like hypostasis, rigor mortis, etc. Pharmaceutical agents like medications and illegal drugs. The problem is they're not found when they OD or overdose. Advanced decomposition can set in with illegal drugs because a lot of times they're not found when they overdose. Those are all the intrinsic factors. Extrinsic factors include environmental, and environmental includes atmospheric conditions, moisture or lack thereof, thermal influences like too high or too low of temperature and no decomposition. A problem is warm and moist as far as thermal influences. Microbial influences, this is how Mother Nature cleans up after herself, is microbial influences. Vermin, insects, rodents, coyotes, fish, etc. Rats are the worst. Rats are the worst as far as environmental and extrinsic. Also, other. It just says other. So, under environmental extrinsic factors on the board exam, if other is an option, it's correct, I guess. Just the mysterious other. Okay. Other extrinsic factors other than environmental is post-mortem interval, which is the amount of time between death and embalming. The shorter, the better, but that's an extrinsic factor outside the body. And embalmers' skill levels is an extrinsic factor because our skill levels vary. Some people are poop. All right. Another extrinsic factor is initial treatment of the body. Oh, wait. Hold on. Is that? Nope, my bad. We're moving on. This is another subject. These notes are kind of hard to read. Okay, so initial treatment of the body with embalming. Disinfection of oral and nasal cavities. Immediately upon unwrapping, irrigate and let it sit in there. Remove and record all clothing and personal effects. It's best to have a witness when you bag it. Disinfection of clothing when necessary. Ask the family. May use Pierce 1 point chemical, the Pierce brand 1 point, to remove blood stains. Remove medical dressings and devices like pacemakers, etc. You must get written permission from family to remove medical dressings and devices like pacemakers. Bathing and external disinfection. Use lukewarm water. The lukewarm water also helps break up rigor mortis. As far as bathing, some other points of bathing, materials and proper procedure. You may use a large soft brush to scrub, but you have to be careful of skin slip. As far as cleaning and disinfecting agents, you want to use antiseptic soaps and sprays, antiseptic. And as far as the position of the body prior to embalming, the order of this is optional. Place the body in the same position it will be in the casket. The body should be placed on a table with the head elevated above the rest of the body. Be sure the body is straight on the table. Look from the head of the table down to a line. Wetting the table makes moving the body easier. The head should be placed on the headrest in such a way that it will not interfere with distribution of fluid and drainage. You may lay the head back to expose the neck until the lines are in. Forehead to tip of nose should be a straight line, horizontal. Forehead to tip of nose should be a straight line, horizontal. The face may be tilted to the right about 15 degrees, to the right about 15 degrees, which is generally preferred casketing position. Line up the tip of the nose with their right big toe. The neck must be aligned in such a way that there will be no interferences with distribution of fluid and drainage. Hands should be placed in a desirable position. There is no set rule. Check with your funeral home for policy on the hand position. We actually learned left over right, and that's so that if there's a wedding ring, it will be displayed. That was what we learned in college, so that's kind of different. Who knows which one will be on the board exam, you know. Arms may need to be elevated or otherwise posed for effective positioning of the hands. Shoulders may need to be elevated to effect proper neck alignment. You may place positioning device along spine to allow shoulders to drop. The use of additional impermeable posing devices may be necessary in special situations for proper body positioning. Posing the features to create feature naturalness. The order of this is optional, it says. Shaving. If required, you may use scissors to trim down facial hair to a shavable level. Ask the family if in doubt about a beard. Ask about a beard before you go messing with it. Prepare the face with cream or oil. It's optional. The application of a massage cream or oil at this time may have the following effects and also helps break up rigor. Sorry, this app I'm using is pissing me the fuck off. Because if my phone goes dark, it stops the video. And I have to start recording again. Now I don't know where the fuck I was. Okay. Posing the features to create feature naturalness, order optional. Shaving, if required, you may use scissors to trim down to a shavable level. Ask in doubt about a beard. Prepare the face with cream or oil. Cream or oil is optional. The application of a massage cream or oil at this time may have the following effects. It also breaks up rigor. Don't go overboard. May have the following effects. Massage oil or cream. It cleanses tissue pores. It retards dehydration. It's a base for further massage. It's a base for cosmetics. Now, closing the mouth. Precautions you have to take. Excessive manipulation of the lip tissue can cause distension later when you inject. Sharp teeth can cause personal injury to the operator. The procedure for closing the mouth is to relieve rigor mortis, disinfect and cleanse the oral and nasal cavities, use cotton swabs to remove disinfectant placed there earlier, remove and cleanse and disinfect dentures, observe the normal bite of the decedent. Is there natural teeth? Is there dentures? Do you need mouth formers? Mouth formers is the device used in the mouth in shaping the contour of the lips. Observe points of natural expression. As far as the points of natural expression, this includes 5 arcs in the line of the upper lip. Points of natural expression, there's 5 arcs in the line of the upper lip. It's not a straight line, it's a classic hunting bow. 5 arcs in the line of the upper lip, and it's a classic hunting bow shape. Protrusion of the upper lip. The upper lip is slightly elevated over the lower lip. The upper lip is slightly elevated and protruding over the lower lip. Natural facial lines. Outer edges of mouth should align with center of eyes. Natural facial lines. Outer edges of mouth should align with center of eyes. So if you run your fingers up from the outer corner of your mouth, it should run right between your pupils. And you want the same for the decedent. Corners of the mouth are slightly raised. You may place something like cotton, etc., in corners of the mouth to build it up to a desired level, but the corners of the mouth are slightly raised. So, points of natural expression, 5 arcs in line of upper lip, classic hunting bow of upper lip. Upper lip protrudes and is elevated over lower lip. The outer edges of the mouth aligns with the center of the eyes or the center of the pupil, and the corners of the mouth are slightly raised. Then you must secure the mandible, and there's different ways that you can secure the mandible. There's the needle injector, which is a mechanical device used to impel. Impel. That's the word I was looking for earlier, not hammer, but impel. Specifically designed metal pins into the bone. Musculature suture is a method of mouth closure in which the suture is passed through the septum of the nose and through the mentalis muscle of the chin. It's also known as a frenulum suture. That's because it's going through the septum of the nose, and fancy word for that area is the frenulum. It's right here. The frenulum is a fleshy strip of tissue which attaches 2 body parts together, such as in between the upper and lower lips and the teeth. Oh, my bad, I might have been wrong. Frenulum, fleshy strip of tissue which attaches 2 body parts together, such as in between the upper and lower lips and the teeth. Mandibular suture is a method of mouth closure in which a suture is passed through the septum of the nose and around the mandible. Pretty easy to remember the difference between the two. Muscular sutures goes through the muscles, and the frenulum. Mandibular goes through the septum and around the mandible. And then a wire through bone can be used in special situations. If the lips will not stay closed, use creams to assist lip closure, massage cream or stay cream with beeswax. Use wet cotton strips. Don't push too tight. The weight of cotton will hold the lips together. Use adhesives with Aran Alpha. Make sure to stay inside the weather line of the lips. Inside the weather line of the lips. In extreme situations, particularly with dehydrated lips, close with a subcutaneous suture. Subcutaneous means situated or occurring beneath the skin. It's called the hidden stitch. Careful not to pull too tight. The lips should just barely touch. In extreme prognathism, jaw protrusion, projection of the jaw that may cause problems with mouth closure, alignment of the teeth, prognathism, you may, after obtaining authorization and writing from the family, realign the teeth, extract teeth with written permission. Oh, I didn't know we could do that. I thought you had to be a dentist. Whatever. That's what it says. Extract teeth with written permission. Let the teeth show with the family's authorization. Make an incision posterior, which means to the back, and transverse in the lower lip through the frenulum. Then stitch the lips to the desired length. The placement of wax in the incision will prevent the formation of lines of demarcation. Let's say that again. Make an incision posterior and transverse in the lower lip through the frenulum, then stretch the lips to the desired length, and use the placement of wax in the incision to prevent the formation of lines of demarcation. Closing the eyes. The procedure is you do not manipulate the eyelids any more than necessary. Do not manipulate the eyelids any more than necessary. Cleanse with a suitable non-astringent disinfectant. Nothing that will cause the eye to dry out. Putting cream under the lid may affect better closure and protect against dehydration. Placement of eye caps will aid in eye closure, and you may trim eye caps to size. Location of line of closure is in the inferior or lower 1/3 of the eye socket. Location of line of closure is in the lower 1/3 of eye socket. Lower 1/3 of eye socket. Eyelids should abut, A-B-U-T. What the fuck is that? I guess it means to not overlap. Eyelids should abut, not overlap. If you see that stupid word, it means to not overlap. A-B-U-T. Alpha Bravo Uniform Tango. You know. Okay. So, eyelids should not overlap. It's in the lower third of the eye. Eyelashes should turn out. Special considerations: sunken eyes, non-absorbent cotton or Copoc, and eye caps. Non-absorbent cotton is apparently called Kapok. K-A-P-O-K. Kapok. It's a really stupid word. Injection of massage cream or tissue builder behind the eyeball helps with sunken eyes. Stand at the head of the table to check symmetry. Injection of massage cream or tissue builder directly into the eyeball, you can do for sunken eyes, and you may also use a humectant arterial fluid. Types of eye caps and methods of application. Clear or flesh tone. Various rough surfaces are the types of eye caps. Adhesives may have to use Aran Alpha as a last resort with adhesives. Make sure to keep it off of the eyelashes. With eye enucleation restoration, removal of the eye for tissue transplantation, research, and education. The entire globe of the eye is removed. You can cauterize the socket, use cotton soaked in cavity fluid or drying. Apply a filler. Always use an eye cap. Prosthesis, you can use a ping pong ball, K-POC, which is that non-absorbent cotton, wax, etc. You can use mortuary putty and eye caps. Mortuary putty, the definition of that is a paste to fix or fill. It's also called mastic compound. Cotton and eye caps. The cotton will sink into the socket when it gets wet. Not a great idea, I guess. Corneal sclero button. is that portion of the cornea recovered for plant transplantation in situ something. I don't know. Adhesives in eye cap, cream or putty in eye cap. Something to do with the corneal sclero button. Sorry, it's like, it just says SITU in a period. I'm not really sure what that's the abbreviation for. Okay, moving on to the next section. Finally. Selection of arteries. Considerations and precautions for each artery are based upon accessibility. Are they superficial or deep? Is there surrounding structures? What's the proximity to the aorta, which is the center of circulation? What is the size or diametric? Diametric means size, I guess. What's the effect on posing the body? What's the location regarding the exposed areas? What's the practicality of draining from the corresponding veins? That's all accessibility. Arterial occlusion, which is a fancy word for blockage. There's definitions for this. Wait, hold on. Sorry, this is written so funky. Okay, sorry. Arterial occlusion goes into considerations and precautions for each artery in selection. So accessibility is the first point of selection, and arterial occlusion or blockage is a second consideration. The next section is some definitions. Linear guide is a line drawn or visualized on the surface of the skin to represent the approximate location of some deeper lying structure. An anatomical guide is a descriptive reference for locating arteries and veins by means of anatomical structures that are known. Anatomical limits are points of origin and points of termination in relation to adjacent structures, used to designate the boundaries of arteries. Arteries most commonly used in embalming include the arteries of the head and neck, which are the common carotid artery, the cervical triangle, which is the common carotid, the internal jugular and vagus nerve is the cervical triangle. The linear guide is a point from this is the linear guide for the common carotid, is a point from sternoclavicular articulation to the anterior surface of the lobe of the ear. The anatomical guide is along the medial border of the sternocleidomastoid muscle. The anatomical limits for the right common carotid begins at the level of sternoclavicular articulation and terminates at the level of the superior border of the thyroid cartilage. The left common carotid begins at the level of second costal cartilage and terminates at the superior border of the thyroid cartilage. Place of incision. A clean cut made with a sharp instrument in embalming. A cut made with a scalpel to raise arteries and veins. Supraclavicular means along the superior border of the clavicle. Medial means 1/3 of the clavicle. Middle 1/3 of the clavicle. Parallel means along the posterior border of the inferior 1/3 of the sternocleidomastoid muscle. It's not recommended to do it there. It is visible above the collar of the person's shirt or blouse. Some considerations. Still on the common carotid artery. It gives direct distribution to the face. It's close to the center of venous drainage, which is the right atrium. It's close to the center of circulation, which is the arch of the aorta. Face possibly can be embalmed by using a restricted cervical injection. That's where you clamp off the left common carotid artery. Doing that with a mild solution while the remaining portion of the body can be injected with a stronger solution. This prevents over-injection of the left side of the face. The common carotid has no branches except its terminal branches. Some precautions with the common carotid. Incision may be visible after dressing. Not if the incision is made in the middle third of the clavicle, though. Tubes may leave a mark on the face if allowed to rest against the face while embalming. The face may be over-injected. It's a common problem for the face to be over-injected, and you prevent this with restricted cervical injection. The accompanying vein to the common carotid is the internal jugular. Its relative location is lateral and superficial to the common carotid artery. Lateral and superficial. So to the side and a little above, closer to the surface of the skin. The facial artery. The anatomical guide for the facial artery is along the inferior border of the mandible, just anterior to the angle of the mandible. The place of incision for the facial artery is along the anatomical guide. That's like, no shit. You must inject in both facial arteries, usually used during an autopsy case where the carotids have been pulled up inside the neck and cannot be found. Arteries of the upper extremity. One is the brachial artery. The linear guide for the brachial is from the center of the base of the axillary space to the center of forearm just below bend of the elbow or antecubital fossa. Axillary space is the fancy word for armpit. Brachial artery linear guide, center of base of armpit to center of forearm just below bend of elbow. Anatomical guide for brachial artery. It lies posterior to the medial border of the belly of the biceps brachii muscle. Anatomical limits for the brachial artery. It begins at the inferior border of the tendon of the teres major muscle and terminates at a point just inferior to the antecubital fossa, which is the middle bend of elbow. Place of incision for the brachial is along the linear guide, approximately the middle of the guide. Considerations is the same as those of the axillary. Precautions is the same as those of the axillary. The accompanying vein for drainage is the basilic vein. The relative location is medial and superficial to the brachial artery. Radial artery. The linear guide is on the surface of the forearm from the center of the antecubital fossa or inside of elbow to the center of the base of the second digit, which is the index finger. Radial artery linear guide, center of inside of elbow to center of the base of the index finger, pointer finger. Anatomical guide is just lateral to the side of the tendon of the flexor carpi radialis muscle. Place of incision is the linear guide at the wrist. Linear guide at the wrist for the radial. Ulnar artery. The linear guide is on surface of forearm from center of antecubital fossa to a point between fourth and fifth digits, which is the ring and pinky fingers. Ulnar artery anatomical guide. It lies lateral to the tendon of the flexor carpi ulnaris muscle. It lies between the tendons of the flexor carpi ulnaris and the flexor digitorum superficialis. Place of incision is the linear guide at the wrist. So the place of incision for the ulnar and the radial is at the wrist. Arteries of the trunk. Axillary artery. The linear guide for this is through the center of the base of axillary space and parallel to the long axis of the upper extremity when abducted in the middle of the armpit. Axillary artery. Through the center of the base of the armpit and parallel to the long axis of the upper arm when the arm is put out like you're going to fly. That's what abducted means. Anatomical guide. Posterior to the back of the middle border of the coracobrachialis muscle for the axillary. Anatomical limit. It begins at the lateral border of the first rib and terminates at the inferior border of the tendon of the teres major muscle. Place of incision is along the anterior margin of the hairline of the axilla. So anterior means towards the front. It's along the front margin of the hairline of the axilla, just like the armpit. Considerations. The axillary is close to the face. It's close to the center of circulation. It's close to the center of venous drainage, and the vessels are relatively superficial. Precautions include danger of over-injecting the face, particularly if there is any obstruction present in the other trunk arteries of the body. Anomalies of both artery and vein are common. So the axillary has anomalies of artery and vein. If the arm is not treated properly, it does not appear natural when the body is placed in the casket. And a problem is coagulated proteins want to keep the arm straight out in the position that it was when it was embalmed, because you have to abduct the arm. You have to put it out like they're trying to fly, straight out from the shoulder. And when you're embalming there, it'll get stuck there, is what it's basically saying. Oh, where the fuck was I? Yeah. The axillary has numerous branches, but that's not really a consideration, or it's just a precaution, I guess. Accompanying vein is the axillary vein. Its relative location is medial and superficial to the axillary artery. Then we have the subclavian artery you use to embalm an autopsied body, I guess more often. You get free flow drainage from the subclavian. The anatomical guide is the clavicle. Just remember clavicle for subclavian. Anatomical limits. The right subclavian begins at the sternoclavicular articulation and terminates at the lateral border of the first rib. The left subclavian begins at the level of the second costal cartilage and terminates at the lateral border of the first rib. Brachiocephalic artery. Accompanying vein is the right brachiocephalic vein. There's only one brachiocephalic artery, but there's two veins. The aorta. You normally do not use the aorta to embalm adults. There's the ascending aorta, and then there's the arch of aorta. The arch of aorta arches over the heart and goes down along the anterior portion of the spine. Anterior means going down the back part of the spine. The descending aorta includes the thoracic aorta, located above the diaphragm, and the abdominal aorta, which is located below the diaphragm. So the descending aorta, thoracic aorta, and abdominal aorta is above the diaphragm and below the diaphragm. And this is used to embalm newborns or babies. Accompanying veins for drainage is the superior vena cava, which drains for ascending aorta and the arch, and the inferior vena cava, which drains for the descending aorta. Superior vena cava drains for the ascending aorta and arch. Inferior vena cava drains for descending aorta. superior ascending, inferior descending, right? Yeah. Common iliac artery is the accompanying vein to the aorta. Common iliac artery is the accompanying vein. And the common, oh, wait, hold on. I'm getting all discombobulated here. Okay, the common iliac artery has an accompanying vein, which is the common iliac vein. External iliac artery is used to embalm autopsied bodies. External iliac, not the common iliac. External is used to embalm autopsied bodies. The anatomical guide for the external iliac is the medial border of the psoas major muscle. External iliac is the medial border of the psoas major. The accompanying vein is the external iliac vein. The internal iliac artery, that's the one that goes down into the butt cheeks along the back. The accompanying vein is the internal iliac vein, and this is not used. It's really tiny and not just in the direction of the butt cheeks, but it goes to the urinary bladder. Arteries of the lower extremity include the femoral artery, and that's part of the femoral triangle, which is the inguinal ligament, the adductor longus muscle, and the sartorius muscle. When using one-point injection, drainage is very poor at this location, at the femoral artery and vein. The linear guide for the femoral artery: on the surface of the thigh from the center of the inguinal ligament to the center point on the medial condyle of the femur. Is that a fancy ass word for the kneecap? I think it is. Medial condyle of the femur. That is so ridiculous. I hate these people. Anatomical guide for the femoral artery: through the center of the femoral triangle, bounded laterally by the sartorius and medially by the adductor longus muscle. Anatomical guide, remember adductor longus for the femoral. Anatomical limits: begins at the point posterior to the center of the inguinal ligament and terminates at the opening in the adductor magnus muscle, which is also called the Hunter's canal. Anatomical limit is adductor magnus, Hunter's canal. Anatomical guide is adductor longus. Anatomical longus, guide is the longest, limits is the magnus. Guide is the longest and limits is the magnus. I hope that helps. Or the Hunter's canal. Adductor magnus is also the Hunter's canal. Place of incision for the femoral: along any portion of the superior 2/3 of the linear guide. Place of incision is along any portion of the superior 2/3 of the linear guide, as close as possible to the inguinal ligament. Considerations for the femoral artery: it's large in size, diametric. It's large in size, diametric. The lower portion of the body can be embalmed without concern of distension of the face. You get even fluid distribution to both sides of the face. Precautions for the femoral includes vessels are deep-seated in obese cases if you go down the leg away from the inguinal ligament. Drainage is sometimes difficult to establish and maintain. It sucks. So the author says it sucks. Drainage sucks. Accompanying vein is the femoral vein. Its relative position is medial at the inguinal ligament. progressing to immediately posterior, so towards the back at the apex of the femoral triangle. You come upon the artery first and then the vein. Veins are usually closer to the skin than arteries. But in the leg, you come to the artery first. The legs are opposite. That's the upper part of the body. Popliteal artery is not normally used. The linear guide for the popliteal artery is through the center of the popliteal space parallel to the long axis of the lower extremity. The anatomical limit for the popliteal, it begins at the opening of the adductor magnus muscle, the Hunter's canal, and terminates at the interior border of the popliteus muscle. The place of incision for the popliteal artery is parallel incision on posterior-medial aspect of the thigh, just superior to the popliteal space. It's all just knee, back of knee. Popliteal is all back of knee. Anterior tibial artery. The linear guide for the anterior tibial is from the lateral border of the patella, kneecap, to the interior surface of the ankle joint. So that's the front of the ankle joint. Place of incision for the anterior tibial. Along the lateral margin of the inferior 1/3 of the crest of tibia. Tibia. Lateral margin inferior 1/3 of the crest of the tibia. Posterior tibial artery. The linear guide is from the center of the popliteal space to the point midway between medial malleolus and the calcaneus. Posterior tibial artery has the stupid words malleolus and calcaneus. Place of incision midway this is for the posterior tibial. Place of incision is midway between the medial malleus and the calcaneal tendon. Dorsalis pedis artery, which is the top of the foot. Dorsalis pedis artery, top of foot. The linear guide is from the center of the anterior surface of the ankle joint to a point between the first and second digits. The place of incision is along the superior 1/3 of the linear guide. Other factors governing selection of arteries to be used for injection. I'm coming back to that. Other factors governing selection of arteries to be used for injection. Age. Age is a factor governing selection of arteries. If it's an infant full term, you select the abdominal aorta, make an incision off of the center line 4 inches long, and inject up and down. If it's an adult, that governs the selection of arteries. That's age, infant or adult. Sex, common carotid of female. If she has a low neckline, make sure the incision doesn't show. So sex determines selection of arteries. With weight, it determines selection. Obese people may have no neck. You could use the femoral or brachial artery. Fat might drop down and cover the inguinal ligament. So that would be a bitch. So weight governs selection of arteries. Fat distribution governs selection, as above in number 3 with weight. Disfigurations govern selection of arteries, such as arthritis. The body position may be a problem. Usually has no effect on artery selection, though. So why is that there? Sorry. Disfigurations, arthritis could govern selection of arteries, it says. Tumors, it could be a very hard mass. Tumors also suck up fluid. They are extremely vascular. The weight of a tumor could obstruct distribution of arterial fluid. So that's under disfigurations as far as things that govern selection of arteries. Disease, you may have to use stronger solution to inject. I don't know what that has to do with governing selection of arteries, but it's there. Edema, it's a common problem with congestive heart failure. Edema, the heart fails to pump the lymphatic system and the fluids accumulates in the tissues. The heart fails to pump the lymphatic system and fluids accumulate in tissues. If the body is pressed and it leaves a dent, it's called pitting edema. The secondary dilution from pitting edema is horrendous. You don't use a humectant in that situation. Use a high index fluid and possibly waterless embalming. Alcohol permaflow V2. The body frequently will appear jaundiced. Edema may prevent the use of the femoral artery, but has no effect on using the common carotid. Location obstruction, like congestion, can govern the selection of arteries, as in the legs being blocked, usually at the inguinal ligament. You must get below the blockage to inject, possibly use the anterior tibial artery. Trauma can govern selection of arteries. A physical injury or wound caused by external force or violence is what trauma is. And a subcategory of that, of trauma, is mutilation. If a limb is severed, you might have to use an exposed artery to inject where it's mutilated. You may use a spacer to rebuild the limb and make it the correct length. Make sure to lock the limb in place so it will not move. If touched or patted, you have to put the body back together. In an accident, like a crushing injury, it's more difficult to deal with than amputations where there's reconstruction. Surgery, usually not a complication, but may have to use multi-point injection. Then medico-legal requirements can govern the selection of arteries, such as autopsy protocol. It's usually done before embalming. The internal organs, viscera, are not always returned with the body. Medical examiner or coroner. The medical examiner is an official elected or appointed to investigate suspicious or unnatural deaths. A coroner is an official of a local community who holds inquests concerning sudden, violent, or unexplained deaths. Cause of death can govern artery selection. As an example, a gunshot. The manner of death can govern artery selection, such as suicide, homicide, or accidental. Okay, now on to the next part. Proper technique for raising vessels. Proper technique for raising vessels. Shave the area if necessary. It is not usually necessary. Select instruments and prepare ligature. Be generous with ligature, approximately 18 inches of cord. Locate place of incision. using linear guide. Make proper incision through the skin, superficial fascia and deep fascia. Don't go too deep. Use belly of the blade, not the tip. Blunt dissection through superficial fascia, fat, and deep fascia. Find vessels by use of anatomical guide and relative position of vein. Clean off by blunt dissection and ligate vein loosely. Clean off and ligate artery loosely. Make incision in vessels. Transverse. What is a transverse incision? It is lying at right angles to the long axis of the body. Sclerotic vessels may break in half with a transverse incision. Sclerotic vessels may break in half with a transverse incision. It's lying at right angles to the long axis of the body. Diagonal incision is not recommended. The lip gets in the way. Longitudinal. Down the long axis of the vessel. Sclerotic vessels won't break with this incision. However, they may start to split down the vessel. Longitudinal may split down the vessel. A T incision is a combination of transverse and longitudinal. A triangular or wedge incision is two opposite diagonal cuts like an inverted V. Triangular or wedge, two opposite diagonal cuts like an inverted V. Sutures for closing incisions. You got the baseball stitch. The stitch is made from beneath up through the skin, and the needle is crossed from side to side on each stitch. Inverted baseball. The stitch is made through the skin from outside the incision and up through the opening of the incision, alternating side to side. This stitch allows the skin to be pulled flat and not wrinkle like the baseball stitch, and is much easier to cover with restorative art wax. The draw stitch is the same thing as the single intradermal, except the stitch penetrates completely through the skin. The draw is the same as single intradermal, except it penetrates through the skin, also known as the worm stitch. The worm stitch is also called a draw. Worm stitch is also called a draw. It penetrates completely through the skin. Intradermal, also called the hidden stitch. A single intradermal, the suturing needle is inserted deep into the tissues at one end of the incision. One end of the ligature is anchored there. The suturing needle is brought to the surface and directed through the subcutaneous tissues only, not through the skin itself. The threaded suturing needle is then directed back and forth from one side of the incision to the other until the end of the incision is reached. The suturing needle is now pushed through the tissue for an inch or two and brought out through the skin. The ligature is then pulled to close the incision, and the ligature is cut off close to the skin. Double intradermal, two needle, is made in the same manner as the single intradermal stitch, except that a suturing needle is used on each end of the ligature, two suturing needles, and the ligatures are crossed at each stitch using crisscross motions, just like tying shoes. The lock stitch. You use a large, full, curved suturing needle strung with a strong ligature for the lock stitch. Anchor or tie the ligature at one end of the incision, then pull up the ligature that is anchored. This will pull the tissue up so that the suturing needle can pass through both sides of the incision from the outside. Always keep the ligature tight in the hand that is not holding the suturing needle. After the suturing needle has passed through the tissue, lock the stitch by looping it through the ligature, which is being held. Releasing the ligature long enough to complete the loop, Then catch the ligature and pull it tight again. Repeat until incision is closed. The suturing needle insertion is always made from the same side of the incision. The whip roll stitch. The whip roll stitch. Pass the ligature through both sides of the incision from the outside, going from one side to the other as the incision is sutured. Worm. Same as the intradermal suture, except the stitches are made parallel to the incision. Other methods of closing incisions. Adhesives like Aran Alpha make sure the incision is dry. Surgical staples do not seal well, and it puckers open between staples. Next section. Finally, next section. Vascular injection section. Procedure for vascular injection. 1 point injection, that's where the embalmer injects and drains from one site. Split injection. Arterial injection at one site while drainage is established at another injection. Multi-point injection. Injection procedure where 2 or more complete injection sites are used. Restricted cervical. 1 or both common carotid arteries are raised and occluded for use during the embalming operation. Sectional embalming. Injecting a single extremity like arm, leg, or head, etc. at a time. Used for autopsied cases. Sectional embalming. The methods of vascular injection one is a motorized force pump, also called a centrifugal force machine. Motorized force pump, centrifugal force machine. It's an embalming machine that uses an electrical pump to create pressure, either pulsating or non-pulsating. This is the most commonly used method of injection. Types of a motorized force pump is duotronic, Portaboy, and Sawyer. The pulsating part of it helps push clots out. Alternating pressure surges like the heart does, pumping. But it also does non-pulsating injection. Pressure terminology. Potential pressure is the pressure indicated by the injector gauge needle when the injector motor is running and the arterial tube is clamped off. Potential pressure is the pressure indicated by the injector gauge needle when the injector motor is running and the arterial tubing is clamped off. Actual pressure is the vascular resistance determines the rate of the flow. Actual pressure is the vascular resistance determining the rate of the flow. It's the amount of pressure with rate of flow valve open is actual. Potential is clamped off, actual is open. Differential pressure is the difference between potential and actual. Differential is the difference. It's pretty easy. Potential is clamped off. So, you got potential of pressure, because it's clamped off. Actual is valve open. And differential is the difference. Considerations about this machine. It's reliable, but it can break down. Have a backup system ready, another machine or a gravity injector. No subordinate equipment necessary except tubing, arterial tubes, etc. It has a wide pressure range, some machines more than others. It provides constant pressure, and it has a large unit volume, meaning it can inject quickly. Precautions with this machine is it needs frequent servicing, and it requires constant attention of the operator. Other means of injection. There is gravity injection, which is an apparatus used to inject arterial fluid during the vascular arterial phase of the embalming process. that relies on gravity to create the pressure required to deliver the fluid. 0.43 pounds of pressure per 1 foot of elevation. 0.43 pounds of pressure per 1 foot of elevation. Gravity pressure is approximately half pound pressure per foot of elevation above the point of injection. 28-inch elevation equals 1 pound of pressure. 28-inch elevation equals 1 pound of pressure. The hand pump is a historical instrument resembling a large hypodermic syringe attached to a bottle apparatus. It's used to create either pressure for injection or vacuum for aspiration. The bulb syringe is a self-contained soft rubber manual pump designed to create pressure to deliver fluid as it passes through one-way valves located within the bulb. It is used only to deliver fluids. It cannot be used for aspiration. The bulb syringe can dry out and crack. Combination gravity bottle and bulb syringe works well. Air pressure types of apparatus, mechanical, a pump-up tank by hand like a weed sprayer, and it's not a popular system. Then there's also hydraulic. No information about hydraulic. Pressure discussion. The action of a force against an opposing force, a force applied or acting against resistance, is pressure. Actual pressure is the pressure which is indicated by the injector gauge needle when the arterial tube is open and the arterial solution is flowing into the body. Blood pressure is the pressure exerted by the blood on the vessel walls measured in millimeters of mercury. Differential pressure is the difference between potential and actual pressure. Injection pressure is the amount of pressure produced by an injection device to overcome initial resistance within, which is intravascular or on extravascular, the vascular system, arterial or venous. Hold on. Injection pressure, the amount of pressure produced by an injection device to overcome initial resistance within or on the vascular system. Within or on is where it was saying intravascular or extravascular, arterial or venous pressure. Intravascular pressure is pressure developed as the flow of the embalming solution is established and the elastic arterial walls expand and then contract, resulting in filling of the capillary beds and development of pressure filtration. Potential pressure is the pressure indicated by the injector gauge needle when the injector motor is running and the arterial tubing is clamped off. Desired pressure should be set before any fluid is permitted to flow into the body. Desired pressure should be set before any fluid is permitted to flow into the body. It's in bold, so I'm just letting you know that before is in bold. Okay. As needed, so you do this as needed, no more. Injection pressure is 10 pounds for the body and 2 to 3 pounds for the head. Injection pressure is 10 pounds for the body and 2 to 3 pounds for the head. Factors affecting pressure. Intravascular influence within the blood vascular system, such as condition of vessels, like if they're sclerotic or there's varicose veins. Local congestion, clotting, and coagulated blood is intravascular influence. Extravascular influences are outside the blood vascular system, like the weight of the viscera, like fat people. Gas in the viscera, they're real farty. Farts are extravascular influences. Tumors are a major problem for extravascular influences. Ascite ascites. I don't know how to pronounce that. Ascites, ascites, the edema thing. Is a abnormal accumulation of serous fluids in the peritoneal or abdominal cavity. Peritoneal is a fancy word for abdominal. Peritoneal is a fancy word for abdominal cavity. Also known as edema of the abdominal cavity, ascites, however the fuck you say it. Contact pressure is the weight of the body against the table, preventing HCHO from entering capillaries, or formaldehyde from entering capillaries. Edema of the extremities, abnormal accumulation of fluids in tissue or body cavities. Those are all extravascular influences. Cause of death may be associated with the items above and is an extravascular influence. The post-mortem interval is the time from death to time embalmed. Least amount of time is best. The longer the duration, the greater the adverse effects, such as rigor mortis, state of decomposition, discolorations. The type of apparatus used is an extravascular influence. Pressure machine gives the most options for pressure. Recommended pressures are whatever pressure is necessary to overcome vascular resistance. The rate of flow is the speed at which fluid is injected. It's measured in ounces per minute. Use whatever rate of flow is necessary to achieve uniform distribution without distension, and don't rush it. Don't rush it. Whatever pressure is necessary to overcome vascular resistance. Those are in bold. Next section, types of embalming chemicals. 3 basic types: arterial, cavity, and accessory chemical. Arterial, cavity, and accessory. Vascular is an arterial preservative fluid. Vascular is an arterial preservative fluid. The use of the blood vascular system of the body for temporary preservation, disinfection, and restoration. Accomplished through injection of embalming solutions into the arteries and drainage from the veins. The function of vascular, is preservation, disinfection, and restoration. The purpose is to protect public health. It's sanitation, preservation, suitable memory picture for the family. Classification of the vascular chemical arterial preservative fluid. The index means the strength of the embalming fluids indicated by the number of grams of pure formaldehyde gas dissolved in 100 milliliters of water. Index usually refers to a percentage. An embalming fluid with an index of 25 usually contains 25% formaldehyde gas. 25 index equals 25% formaldehyde gas. Strong high index is between 26% and 36% formaldehyde in the solution. Medium is between 16% to 25% formaldehyde in the solution. Weak or low index is between 5% and 15% formaldehyde in the solution, and that is used for jaundice fluids and for children. Color is one. Index is a classification, and color is another classification. Non-cosmetic fluids is a type of arterial fluid which contains inactive dyes that will not impart a color change upon the body tissues of the deceased. Cosmetic fluids are embalming fluids that contain dyes and coloring agents intended to restore a more natural skin tone through the embalming process. Components are components are just another part of the vascular arterial fluid. Preservatives is a component. The chemicals which inactivate saprophytic bacteria render unsuitable for nutrition the media upon which such bacteria thrive. So basically, preservatives kill the saprophytic bacteria's farmland. Okay? I don't know why they have to say it so stupid. Media upon which such bacteria thrives. Give me a fucking break. So sick of this shit. Stupid Queen's English medical jargon nonsense. I love the Taggart notes, though. It's not his fault. It's not his fault. Where the hell was I? Preservatives. Okay. Chemicals which inactivate saprophytic bacteria render unsuitable for nutrition the media upon which such bacteria thrive, and which will arrest decomposition by altering enzymes and lysins of the body, as well as converting the decomposable tissue to a form less susceptible to decomposition. Must be in there formaldehyde. Disinfectant must be in the solution, formaldehyde. Anticoagulants, also known as water conditioners or water softeners, are an ingredient of embalming fluids that retards the natural post-mortem tendency of blood to become more viscous or prevents adverse reactions between. Oh, my cat scared me. Shit, I thought, I thought I didn't know what the tail was on my leg. And I looked down and I didn't see anything and I thought I was imagining things. And then she jumped. Okay. Okay. Where the hell was I? Oh my God. Anticoagulants, also known as water conditioners or water softeners, ingredient of embalming fluids that retards the natural post-mortem tendency of blood to become more viscous or prevents adverse reactions between blood and other embalming chemicals. Sequestering calcium ions and magnesium. Vehicles. Vehicles are liquids that serve as a solvent for numerous ingredients that are incorporated into the embalming fluid. It must be in there. A vehicle must be in there. There's two types. Number one is water. Water is a vehicle, and number two is alcohol, also called methyl. Alcohol is also called methyl, and it's a vehicle. A surfactant is a wetting agent, a surface tension reducer, it's a penetrating agent, or surface active agent. Chemical that reduces the molecular cohesion of a liquid so it can flow through smaller apertures. That is a surfactant. Dyes are coloring agents. That's substances which will, upon being dissolved, impart a definite color to the embalming solution. Dyes are classified as to their capacity to permanently impart color to the tissue of the body into which they are injected. Cosmetic dyes stain the tissues. Non-cosmetic dyes just color the solution without staining the tissues. Perfuming materials are also called masking agents. That's chemicals found in embalming arterial formulations having the capability of displacing an unpleasant odor or of altering an unpleasant odor so that it is convened to be a more pleasant one. Also covers the odor of HCHO. That is a lot of words just to say poopery. Okay. Perfuming materials, masking agents, displacing an unpleasant odor. Esters It is an alcohol with an organic acid and benzaldehyde. Those are perfuming materials. Esters, alcohol with organic acid, and benzaldehyde are pooperies. Modifying agents are chemicals added to the embalming solution to deal with varying demands predicated upon the type of embalming, the environment, and the embalming fluid to be used. That's a modifying agent, which includes a humectant and a buffer. Those are modifying agents, humectants and buffers. A humectant is a chemical that increases the ability of the embalmed tissue to retain moisture. Buffers is an embalming chemical that affects the stabilization of the acid-base or pH balance within the embalming solutions and in the embalmed tissue. Try to maintain pH at or near a neutral 7. Maintain pH at or near a neutral 7. The effects. Glutaraldehyde is a better disinfectant than a preservative. Glutaraldehyde is a better disinfectant than a preservative. Use it to clean instruments as opposed to embalming with it. Glutaraldehyde, use it to clean instruments as opposed to embalming with it. On body tissues, it varies according to what chemical is being used. On tissue fluid, cavity fluids are embalming chemicals that are injected into the cavities of the body following the aspiration and cavity embalming. Cavity fluid can also be used as a chemical in hypodermic and surface embalming. It has very few additives. The purpose of cavity fluid is preservation and treatment of internal contents of hollow organs. Cavity fluid, preservation and treatment of internal contents of hollow organs. Composition of cavity fluid. Preservatives and fixatives are chemicals which inactivate saprophytic bacteria, rendering it unsuitable for nutrition, the media upon which such bacteria thrives, and which will arrest decomposition by altering enzymes and lysins of the body, as well as converting the decomposable tissue to a form less susceptible to decomposition. Disinfectants is an agent, usually chemical, applied to inanimate objects or surfaces to destroy disease-causing microbial agents, but usually not bacterial spores. Vehicles are liquids that serve as a solvent for the numerous ingredients that are incorporated into embalming fluids. Water and alcohol are the only two vehicles. Effects. Supplemental fluids. A fluid injected for the purpose other than preservation and disinfection is a supplemental fluid. It's a fluid injected for purposes other than preservation and disinfection. Supplemental fluids generally fall into one of three categories: pre-injection, co-injection, and humectants or restorative fluids. Pre-injection fluids. The definition of pre-injection fluids is a fluid injected primarily to prepare the vascular system and the body tissues for the injection of the preservative vascular arterial solution. This solution is injected before the preservative vascular solution is injected. No preservatives. The purpose is to break up clots, rigor, and control pH. Co-injection fluids. The definition of that is a fluid used primarily to supplement and enhance the action of vascular arterial solutions. Supplement and enhance is co-injection fluids. Supplement and enhance. The purpose is to modify the preservative fluids with humectants and buffers, etc. A humectant or restorative fluids. The definition of a humectant is a chemical that increases the ability of embalmed tissue to retain moisture. The purpose is to retain moisture in the body. Co-injection fluids. The definition of this is a fluid used primarily to supplement, and enhance the action of the vascular arterial solutions. The purpose is to modify preservative fluids with humectants, buffers, etc. A humectant or restorative fluid definition is a chemical that increases the ability of the embalmed tissue to retain moisture. Purpose: retain moisture in the body. Jaundice fluids. The definition is a special vascular fluid with special bleaching and coloring qualities for use on bodies with jaundice, usually low formaldehyde content, usually phenol-based. The purpose is that it's a low-index fluid, and jaundice will turn green in the presence of HCHO formaldehyde. This jaundice fluid bleaches and colors tissues. The components of jaundice fluid is low HCHO, 8% or less, has phenol, etc. It has reducing agents. That's a substance that easily loses electrons and thereby causes other substances to be reduced. Formaldehyde is a strong reducing agent. Reducing agents causes other substances to be reduced. Formaldehyde is a strong reducing agent. Bleaching agents is a chemical that lightens a skin discoloration. Also in bold, the reducing agents easily loses electrons, thereby causing other substances to be reduced. I go back and emphasize that. Bleaching agent is pretty straightforward. Counter staining agents is a dye that helps to cover internal discolorations. Counter staining agents helps to cover internal discolorations such as jaundice. So the jaundice fluid is a counter staining agent. High preservation demand fluids, such as those used for bodies showing evidence of extended refrigeration, frozen tissue, or advanced decomposition. That's high preservation demand fluids. Accessory chemicals are a group of chemicals used in addition to vascular or arterial chemicals and cavity embalming fluids. Accessory chemicals include, but are not limited to, hardening compounds, preservative powders, sealing agents, mold preventative agents, and pack application agents. Hardening compounds. The definition of a hardening compound is a chemical in powder form that has the ability to absorb and disinfect, which is germicidal. Hardening compound is germicidal because it absorbs to disinfect. And it's often used in cavity treatment of autopsied cases. The purpose composition is that it's a hardening agent like plaster of Paris and has an exothermic reaction. Plaster of Paris is a hardening compound. It has an exothermic reaction. It's a disinfectant. Paraformaldehyde is a solid white powder form of HCHO. Paraformaldehyde is a solid white powder form of HCHO. It's a hardening compound. Alum is a dehydrating and disinfecting agent. Moisture absorbents are hardening compounds. Wood powder is a hardening compound. Clays, also called whiting, but clays are a hardening compound. You also may use kitty litter to get the same drying effect, and it's much less expensive. Must use a mask when applying because powder will plug up the lungs. Kitty litter. Alrighty then. Okay. That's pretty cool. Good information for the zombie apocalypse. Mold preventative agents. Definition of mold preventative agents is those agents that will prohibit the growth of mold. Derp. Purpose is to prevent mold. Derp. Composition, paradichlorobenzene. It's a benzene ring with two CI attached at the opposite ends. Mold preventative agents is paradichlorobenzene. Benzene ring with two CIs attached at opposite ends, or cresol. Cresol is a word for a mold preventative agent. It's a benzene ring with an OH group attached at one point and a CH3 group attached to the other. Lysol is a combination of the three allotropes of cresol. So you see benzene ring, it's a mold preventative. Preservative powders. The definition of this is a chemical in powder form, typically used for surface embalming of the remains. Purpose and composition, it's paraformaldehyde or paraform. Preservative powders is moisture absorbing agents. Sealing agents you should only use if necessary. Incisions should not leak without sealing agents. Definition, material used to provide a barrier or seal against any type of leakage of fluid or blood. The purpose is to prevent leakage from an incision or puncture in the skin. The types of sealing agents are powder, creams, sprays, which are not very effective, liquids and gels. Surface applications of the liquids and gels. The purpose is to dry and harden lesions, excisions, and cavities. Treat decubitus ulcers and other open sores. Is the purpose of surface applications of liquids and gels. The composition of the sealing agents is coagulating agents or tanning agents. Preservatives in it is phenol and cresols in the sealing agents, and the vehicles or organic solvents are methanol or methyl alcohol. The vehicles can only be either water or alcohol. And with the sealing agents, it's methanol, methyl alcohol. Safety and handling embalming chemicals in accordance with OSHA Hazard Communication Standards, Section 1F. Don't drink or breathe the fumes. Practice universal precautions. Next section. Dilution section. Terms relative to fluid dilution are primary dilution. QSAD is quantity sufficient added. What the fuck is the D? Okay, who cares? I guess dilution, quantity sufficient added. I don't know. The definition of primary dilution is the dilution attained as the embalming solution is mixed up in the embalming machine reservoir. The determination of dilution needed by embalming analysis is the primary dilution. It's also to find the right amount of fluid by formula. The amount of concentrate is to the amount of solution as the percent desired is to the index of the concentrate. There's that stupid formula. CXV equals C to the first times V to the first. 128 ounces equals 1 gallon. Secondary dilution is the weakening of embalming fluid by the fluids in the body, both vascular and interstitial. Normal dilution. Normal is the dilution of the already dilute fluid by the fluids of the body. Conditions varying with edema and dehydration. Terms relative to fluid movement. Fluid distribution. That is the movement of embalming solutions from the point of injection throughout the arterial system. Fluid distribution is throughout the arterial system and into the capillaries. External pressure, machine, or gravity is moving the fluid. Fluid diffusion is the passage of some components of the injected embalming solution from an intravascular to an extravascular location. Movement of the embalming solutions from the capillaries into the interstitial fluids, accomplished through osmosis. So, distribution is throughout the arterial system. Diffusion is from the capillaries into the interstitial fluids, accomplished through osmosis. Pressure filtration is positive intravascular pressure causing passage of embalming fluid through the capillary wall to diffuse with the interstitial fluids, causing passage of embalming fluid from an intravascular to an extravascular position. If pressure is too great, it will cause swelling of the tissues. Movement from an intravascular to an extravascular position is pressure filtration. It's the result of positive intravascular pressure. It results in the mixing of the embalming chemicals with the interstitial fluids. So pressure filtration, pressure causing passage. Pressure filtration is pressure causing passage through the capillary wall. Osmosis is the passage of solvent from a solution of lesser to one of greater solute concentration, when the two solutions are separated by a semi-permeable membrane. This is the process through which most embalming chemicals are moved from the interstitial fluids through the cell wall into the cell. That's osmosis. The process through which most embalming chemicals are moved from the interstitial fluids through the cell wall into the cell. Terms associated with osmotic movement include hypotonic, which is a solution having lesser concentration of dissolved solute than the solution to which it is compared, which means hypotonic has more water and will cause tissues to swell. Isotonic is a solution having an equal concentration of dissolved solute, so that of a standard reference. Hypertonic is a solution having a greater concentration of dissolved solute than solution to which it is compared, so hypertonic has less water. This will cause dehydration and formaldehyde gray. So hypotonic is lesser concentration. Isotonic is equal concentration. Hypertonic is greater concentration. Osmotic pressure occurs across semi-permeable membrane when there is a gradient, which is a difference in concentration of dissolved particles in the solution. Dialysis is the separation of substances in solution by the difference in their rates of diffusion. Dialysis is the separation of substances in solution by the differences in their rates of diffusion through a semipermeable membrane. Separation of a crystalloid, which is a true solution or small particles, from a colloid, which is larger particles suspended in a solution. Colloids will not pass through the membrane. Colloids will not pass through the membrane. Gravity filtration is the extravascular movement of preservative fluids by gravitational force to the dependent areas of the body. It's always directed downward to the lowest point of the body. Essentially pressure filtration, just using the force of gravity. Gravity filtration is essentially pressure filtration, just using the force of gravity. Signs of fluid distribution include distension of superficial vessels, a large volume of blood drainage, a reduction of intravascular blood discolorations. Signs of fluid distribution. Signs of fluid diffusion. Loss of elasticity of tissue. In other words, it's beginning to firm. That's diffusion, beginning to firm. Drying out of the tissue. Tissue distension, like in the lips and fingertips where it's puffing up. Mottling of tissue, which shows bleaching. Tissue fixation. Touch everything before starting. Feel for firmness as you inject fluid. Summary of all factors related to fluid and its injection. Here's a summary. Amount of fluid to use. Enough to displace blood in the body, approximately 3 gallons. Use 1 gallon per 50 pounds of body weight. Rule of thumb. Strength of solution. Based on decomposition, edema, and nitrogenous waste products, you choose strength of solution. Temperature of solution. You want tepid or lukewarm. Pressure of injection. Pressure necessary to overcome vascular resistance and push the blood out is the pressure of injection. Approximately 10 pounds for a body and 2 pounds for the head. 10 pounds for the body and 2 pounds for the head is the pressure of injection. Rate of flow. Only as fast as the blood will drain from the body or it will swell. Relation of each of the above to disinfection, preservation, removal, and discolorations and swelling. I don't know what that's saying. Next section. Drainage is discharge or withdrawal of blood, interstitial fluid, and embalming fluids from the body during vascular embalming. Usually removed through a vein of the body. Drain from the vein next to the artery you are injecting into. Purpose and importance of drainage is to diminish secondary dilution, remove intravascular discolorations, flush blood out of the capillaries next to the skin, basically, prevent distension and swelling. Distension and swelling is a big problem. Swelling is not uniform. An eye or ear might bulge. The neck has problems with swelling and drainage. Drainage also permits disinfection, and it retards post-embalming decomposition. Drainage procedures are a closed drainage technique to limit blood exposure. A drain tube with a hose connected to the drain is closed drainage, a technique to limit blood exposure. You take the drain tube with a hose connected to the drain. Use of procedure which allows control of drainage by vein tubes inserted into veins or into the right atrium by means of flexible tubes. Methods of drainage in relation to injection. Alternate drainage. Inject for a while, then drain for a while, then repeat. Intermittent drainage. Alternately opening then closing the drain tube. Injection is continuous with this method. Injection is continuous with intermittent, but you're alternately opening and then closing the drain tube. Concurrent or continuous drainage is the best method. Do both simultaneously, just let them run. Methods of stimulating distribution and drainage: raising and lowering extremities. Pressure, 10 to 15 pounds of pressure. Massage, wash the body while massaging at the same time. Use a brush to clean the fingernails. Instruments, angular forceps work well to pull clots out of the vein. Pre-injection, break up blood clots and expand capillary walls. Increase the rate of flow carefully, only as fast as the blood exits the body. May cause edema by increasing the rate of flow. Use pulsation. Select another drainage site. If vein is damaged, use another jugular or femorals, or heart tap with a big bore trocar. Components of drainage is the embalming solution, the blood and blood clots, the interstitial fluid. That is the fluid in the supporting connective tissues surrounding the body cells. About 1/5 of the body weight is interstitial fluid. Lymphatic fluid is the same stuff as interstitial fluid. It's just called lymphatic after picked up by the lymphatic system. Those are the components of drainage: embalming solution, blood and blood clots, interstitial fluid, lymphatic fluid. But remember, for fuck's sake, 50% of drainage that comes out of the body is always embalming solution. At least. Difficult drainage problems, you can use a heart tap. You can raise the limb and massage. You might inject and drain the limb separately. Next section, cavity treatment or cavity embalming is direct treatment other than vascular arterial embalming of the contents of the body cavities and the lumina of the hollow viscera. It's usually accomplished by aspiration and then injection of chemicals using a trocar. Hollow cavities of body or contents of hollow organs. General considerations. The purpose of cavity treatment is because disinfection and preservation are the embalming objectives, it is necessary to supplement that secured by means vascular injection. While the viscera receive embalming chemicals injected arterially as they do blood and life, there is no assurance that the contents of the hollow organs, such as stomach, small intestines, colon, urinary bladder, etc., and foreign matter, such as pus, I'd assume poop too, between the organs will be adequately disinfected as a result of vascular injection. Ew, we have pus between our organs. I didn't need to know that. All this nasty shit in here, and that was what just grossed me out. Nothing else grosses me out, but pus. Ugh. I want to clean my organs now. Because of decomposition of non-disinfected matter mentioned under A above, odor, purge, and an acceleration of putrefactive changes in the body may occur. With cavity treatment, purge may occur. Carbohydrates in the stomach will produce gas and force the contents out as purge. Carbohydrates in the stomach will produce gas and force the contents out as purge. With cavity embalming. For insurance against putrefactive changes in tissues within the body cavities, which due to obstructions in circulation may not have been thoroughly disinfected and preserved by arterial embalming. For insurance, cavity treatment is insurance against putrefactive changes in tissues that may have not been thoroughly disinfected by arterial embalming. Theories about cavity treatment. Immediately after vascular injection to prevent gas formation and other putrefactive changes from starting or continuing is the best way. So cavity injection immediately after vascular injection prevents gas formation, putrefactive changes, and from starting or continuing. Also, an hour or more after vascular embalming has been completed to allow sufficient time for the arterial injection to take effect. Why waste the time? The abdominal regions is a 9-region plan. Note, heart and lungs are not in the abdominal region. By means of 4 imaginary planes, 2 of which are horizontal, indicated by lines drawn across the right and left 10th ribs and across the right and left anterior superior iliac spines, and 2 sagittal, indicated by lines drawn from the midpoint of inguinal ligament to nipples of the chest, right and left sides. Division of abdomen. 9 regions by means of 4 imaginary planes, 2 of which are horizontal or transverse, and 2 are sagittal. The upper row is the right hypochondriac, epigastric, and left hypochondriac is the upper row. You should draw this. Just fucking draw it. The middle row is the right lateral, the umbilical, and then the left lateral. The lower row is the right inguinal, also called iliac, the pubic, and then the left inguinal iliac. The 4-region plan is the division of the abdomen. 4 regions by means of 2 imaginary planes, 1 horizontal or transverse, and the other vertical or sagittal. The upper right quadrant, the upper left quadrant, the lower right quadrant, and the lower left quadrant. Trocar guides. Trocar guides is a line drawn or visualized on the surface of the body or a prominent anatomic structure used to locate internal structures during cavity embalming from a point of reference 2 inches to the left and 2 inches superior to the umbilicus. The stomach is a direct trocar point toward the intersection of the 5th intercostal space and the left mid-axillary line, and you continue until the trocar enters the stomach. The cecum. For the cecum, the trocar guide, you direct the trocar point toward a point 1/4 of the distance from the right anterior superior iliac spine to the pubic symphysis. Keep the point of the trocar well up near the abdominal wall until within 4 inches of the right anterior superior iliac spine. Then dip point 2 inches and insert it forward into the colon. Trocar guide for the urinary bladder. Direct the trocar toward the intersection of median line and pubic bone, the symphysis pubis, keeping it well up toward abdominal wall until it touches the bone. Then withdraw about 1/2 inch and dip the point slightly and insert into the bladder. The right side of the heart, the trocar guide for the right side of the heart. Direct the trocar point along a line from the left anterior superior iliac spine to the lobe of the right ear. Keep the point up against the cavity wall until it has pierced the diaphragm. Then dip it downward and insert into the heart. Aspiration and injection equipment and methods. Equipment for aspiration and injection. Trocar tubing, hydroaspirator. You're in danger of contamination to source of water supply, must comply with city ordinance or regulation. Hydroaspirator. Electric aspirator. That's equipment for aspiration and injection. I didn't know electric aspirator. Oh, electric aspirator. I was thinking spatula. I'm getting sleepy. Electric aspirator. Okay. Abdominal, pelvic, and thoracic cavities. The trocar method is to prepare equipment and enter a trocar through the abdominal wall. Thoroughly puncture and channel all thoracic, abdominal, and pelvic organs. No specific sequence is necessary. Inject sufficient undiluted cavity fluid under pressure to saturate all organs and all regions of the cavities. Treatment of the trocar puncture. Trocar button and sutures. Open, cover with cotton and impermeable material. Removal of purge material in throat. Aspirate through a curved nasal aspirating tube introduced into the throat through the mouth or one of the nostrils. Suitable disinfectant solution may be injected into the throat by use of the same equipment. Cranial cavity, cranial embalming, is a method used to embalm the contents of the cranial cavity through aspiration and injection of the cranial chamber by passage of a trocar through the cribriform plate. Use a baby trocar. Very rare procedure. Conditions necessitating treatment. Diseases of the brain, cerebral hemorrhage, and gas within the cranium. The preferred method for cranial embalming is to aspirate by means of small bore trocar introduced into the nostril and through the cribriform plate of the ethmoid bone, then inject sufficient undiluted cavity fluid. Reduction of distended neck didn't drain properly. Reduction of distended neck that didn't drain properly. Channel the neck tissues with a trocar after vascular injection and prior to abdominal treatment to allow for drainage of excess liquids into body cavity. Reaspiration. Reaspiration is repeated aspiration of a cavity. Conditions necessitating reaspiration. Blood infection, advanced decomposition, ascites, ascites, whatever, accumulation of serous fluid in the peritoneal abdominal cavity. Pulmonary infections, infectious diseases of abdominal organs and tissues, obese bodies, whenever gas formation causes abdominal distension or purge after embalming is completed. Prior to shipping, always reaspirate. Treatment for reaspiration. Reaspirate a few hours after embalming. Gives time for shit to settle. Reaspirate just before dressing and casketing the body, just to be safe. Additional cavity fluid may be injected. Materials that need to be aspirated include gases, fluids, and semisolids. All right. Oh, where was I? I thought I had it ready. You gotta be shitting me. There it is. Okay. My nose is a little messed up, so I might sound nasally. Purge treatment. Treat purge prior to embalming. Cream the areas over which the purge matter flows to minimize burning of the lips, cheeks, and neck. Reduce gas pressures in the abdomen by the careful insertion of a trocar, also called popping the abdomen. And as you know, no one is careful about it. They're just like pop. So that's kind of funny. Purge during embalming. Determine that the escaping substance is purge material, such as stomach or lung purge, and not arterial embalming solution, which may be escaping from damaged lung or stomach tissues. If it is purge, treat as in 2 above, which that was reduce gas pressures in the abdomen by careful insertion of a trocar. That's what you do if it is actually purge. If it is arterial fluid, perform regional, aka sectional injection. Purge following arterial and cavity embalming. Re-aspirate and re-inject concentrated cavity embalming fluid until purge is controlled. If it won't stop from the mouth, tie off the trachea. Other treatments for purge: nasal tube aspiration of the throat. The instrument to aspirate the throat by the way of the nostrils is the nasal tube. Aspiration and injection of the brain through the cribriform plate when distended eyes indicate intracranial decomposition. Next section, autopsies, necropsy, or post-mortem examinations. Autopsies are also called necropsies or post-mortem examinations. The definition is a post-mortem examination of the organs and tissues of a body to determine cause of death or pathological condition, a necropsy. First type of autopsy is regional. And with regional, starts with cranial treatment. So before posing the features, thoroughly cream the forehead, open the cranial incision, remove calvarium. The calvarium is the dome-like superior portion of the cranium. That portion removed during cranial autopsy. Remove the brain if it is present. Immerse the brain in suitable embalming chemical. Ligate or clamp leaking vessels in interior of cranium during arterial injection of the head, the right and left internal carotid arteries. That's the, if you need to ligate or clamp leaking vessels, it's the right and left internal carotid arteries. Or maybe that's where you inject. It doesn't say. I haven't done a lot of autopsies. Ligate or clamp leaking vessels in interior of cranium during arterial injection of right and left subclavian arteries, aka vertebral arteries. Following arterial injection, clean and dry the interior of the cranium. Cover the base of the skull with quick drying sealer. Replace the brain covered in hardening compound. Replace and secure the calvarium. Do the wiring between drilled holes or use calvarium clamps. A few different ways that you can secure the calvarium. Wiring between drilled holes, calvarium clamps, which is a device used as means of fastening the calvarium after a cranial autopsy, or adhesives. Then fill the line of the bone incision. Return the scalp to normal position, and then suture. And there's a few different sutures here that you can use for the cranium. You can use the baseball suture. You use a fine, tight suture with a half curve needle, half curve needle, You can use a whip suture. You can use an intradermal subcutaneous suture. You can use adhesives, but it says don't bother because they do not work for this. Thoracic or abdominal autopsy treatment. The procedure is to reopen the cavities, remove the viscera, cleanse, and put it in a container with suitable embalming chemicals. Examine damage done to the blood vascular system. There will be some. It's in bold. Regional sectional vascular embalming is next. The common carotid arteries are used for the head. The subclavian arteries are used for the neck and shoulder extremity. The axillary arteries are used medially and laterally. The internal iliac arteries are the gluteal and perineal areas. So you do actually get to the internal iliacs if you are having trouble getting distribution to the buttocks or perioneal areas. External iliac arteries are for the lower extremities and anterior abdominal wall. So lower extremity and the front of the body abdominal wall. Aspirate all drainage during the injection of formaldehyde or other hazardous chemicals. Keep the cavities as dry as possible during the embalming process. Formaldehyde, or aka HCHO, the definition is a colorless, strong-smelling gas that when used in solution is a powerful preservative and disinfectant. A potential occupational carcinogen. Next, you're going to treat unpreserved areas of the trunk. You can do that hypodermically or with surface embalming. Use a liberal amount of hardening compound on viscera as the viscera are replaced in the cavities. So a liberal amount of hardening compound. If a plastic viscera bag is used, replace preserved viscera in the plastic bag in cavity. If viscera are kept by the examiner, use cotton filler or wadded up newspaper. Ligate rectum and esophagus and pack trachea and vagina, but it says here not usually necessary. Not usually necessary. Replace and secure sternum and costal cartilages and close the cavity by suture. Spinal autopsies. The body will be short. Obviously, I guess because the spine was removed. You must place a dowel in the column to give the body form. Exploratory removal of bone and soft tissue, I guess, is another type of autopsy. And then partial autopsy is the removal of one or more organs. Organ and tissue recovery, you must have written permission in bold. Organs recovered could be heart, lungs, kidney, liver, or pancreas. Treatment for organs recovered. Refer back to autopsy protocol. Tissues, which could be recovered, includes eye, inner ear, skin, bone. So, organs, heart, lung, kidney, liver, pancreas. Tissues, eye, inner ear, skin, bone. Treatment for tissue recovered. For the eye, there's nothing next to it on the notes. For inner ear, it says refer to cranial autopsy. For skin, use surface embalming treatment. And for bone, you can use either A, vascular, B, hypodermic, or C, prosthesis to treat bone donations. Next section, post-mortem conditions and their embalming treatments. Discolorations. Definition is any abnormal color in or upon the human body. For instructional purposes, only those discolorations which normally are removed during routine embalming procedures and those which may be altered sufficiently during routine embalming procedures to make their concealment less difficult by the restorative artist will be considered here. Classification according to occurrence. Antemortem is a discoloration which appears on the human body during life. The fact that it may remain after life is extinct will not cause change of its classification. So antemortem discolorations, even after death, when the person becomes post-mortem, it's still an antemortem discoloration because it was something that happened before they died, I guess. Post-mortem is a discoloration which makes its appearance on the human body only after the death of the body. Only after the death of the body. Classification according to cause. Blood is discolorations resulting from changes in blood composition, content, or location. Intravascular blood discolorations, either antemortem or postmortem, are easily removed by vascular and injection drainage. The extravascular discolorations are not substantially reduced. Intravascular blood discolorations, embalming will help with that, with intravascular blood discolorations. Antemortem discolorations include hypostasis, carbon monoxide cherry red, capillary congestion, capillary congestion, and it's just those three. Okay. Hypostasis, carbon monoxide, capillary congestion. So hypostasis is the settling of blood or other fluids to dependent portions of the body, and it causes a blue-black color. Hypostasis is the settling of blood or other fluids to dependent portions of the body, and it causes a blue-black color. Carbon monoxide cherry red is very characteristic. It goes away with early embalming. These are intravascular antemortem discolorations. Capillary congestion is hypostatic, active, pumping up, passive blockages of the veins. Post-mortem, gravity works on these discolorations, pulling blood down to the lowest point. Extravascular blood discolorations, embalming will make worse. So, antemortems, so these extravascular blood discolorations that occur before death, which embalming will make worse, includes ecchymosis, which is bruises with no swelling. Ecchymosis, bruises with no swelling. Petechia, which is pinpoint bleeding. During suffocation, this will occur around the eyes. The red pinpoints show up in the sclera. Hematomas, it's a bruise and blood-filled swelling. Bruise and blood-filled swelling. So, extravascular blood discolorations, antemortem, that embalming will make worse. Ecchymosis, petechia, and hematoma. Post-mortem hemoglobin decomposition. General treatment of discolorations of the blood. Flush the vascular system of the discolored or discoloring blood by varying the type, strength, and quantity of the injection chemical. Type and strength should be such that the blood will not be further modified to, quote, set, quote, the discoloration. Quantity should be such as would fill and flush all parts of the vascular system, but would not cause rupturing of the vascular system to convert the intravascular discoloration to an extravascular type. To assist in increasing the flow of injection chemicals to the region of the discoloration and to assist the flow of venous blood drainage from the part, certain mechanical aids may be used, such as alternately raise and lower the part, manual massage with proper skin lubrication. If the discoloration is localized, sectional, arterial injection, and venous drainage may be used in that part. Increased pressure and limited drainage may be used to ensure vascular filling of injection chemicals. The resulting distension of the vessels may aid in the removal of the blood. Special extravascular discolorations, either antemortem or postmortem, are not removed without special treatment. In addition to the treatment given above, the following may be necessary. This is special extravascular discolorations, antemortem or postmortem. Operative aids during arterial embalming may help drain the discolored area of blood. Especially when the discolored area is swollen, it may be incised directly or punctured and channeled to induce the direct outflow of the extravasated blood and accumulated serums. Sectional or local hypodermic injections of chemicals designed to bleach and preserve the discolored areas may be necessary. The discoloration may be lessened in its intensity by applying surface compresses saturated with a proper bleaching agent. Pharmaceutical agents. Antemortem discolorations resulting from the administration of pharmaceuticals or chemotherapeutic agents. Examples of this: pathological discoloration. It's an antemortem discoloration that occurs during the course of certain diseases, like gangrene and jaundice. Gangrene and jaundice are pathological discolorations. Antemortem pathological discolorations. Examples: gangrene, which includes wet and dry gangrene. Jaundice, which a fancy word for jaundice is apparently icterus. Icterus is another word for jaundice. That's fun. Don't remember seeing that bullshit before. Bronzing, which is Addison's disease, and then miscellaneous other examples would be discolorations from leukemia, from tumors, meningitis, which is inflammation of the meninges, peritonitis, which is inflammation of the peritoneum, which is the membranous coat lining the abdominal cavity and investing the viscera. Lupus vulgaris. There's nothing next to lupus vulgaris, but I guess that can have pathological discoloration too. Surface discoloring agents. Antemortem or postmortem discolorations which occur prior to or during embalming due to the deposit of matter on the body's surface. That is, surface discoloring agents. And examples of surface discoloring agents are adhesive tape, blood, grease, ink, iodine, betadine, mold, oil, paint, and tobacco tars. Tobacco tars is the yellowing or browning of the fingernails and fingers from excessive use of cigarettes. It is a surface discoloration. Methods of removal: use lemon juice. Lemon juice is what was recommended for nicotine stains. Mechanical method of removal: use an abrading device and wash with suitable cleaning agents and soft cloths or brushes. Chemical method of removal: use proper solvent when discoloration cannot be removed by mechanical cleaning. Doesn't say what the proper solvent is, but use a proper solvent. Importance of pre-embalming removal is because it may conceal signs of fluid distribution or diffusion. You want to see the color of the fingernails. You can't if they're brown from cigarette smoke. Some are more difficult to remove after the tissues have firmed. So remove the surface discolorations before embalming because they might be more difficult to remove after firming. Reaction of embalming chemicals upon body contents. Postmortem discoloration that may be present before embalming but has become more intense, changed in hue, or may have evolved due to embalming. That's a reaction of embalming chemicals upon body contents. Examples: razor burns, or desiccation marks. Razor burn is also called a mark of desiccation. Cover it with cream, it says. I think it's more important to remember that razor burn is also called desiccation marks. Formaldehyde gray is a reaction of embalming chemicals upon body contents. It's the gray discoloration of the body caused by the reaction of formaldehyde from the embalming process with hemoglobin to form methyl hemoglobin. Hypertonic. It says in bold. I don't know why. It's just thrown in there. And underneath we have a conversion of bilirubin to biliverdin in the presence of formaldehyde and eye enucleation discoloration. This is also examples of the reactions of embalming chemicals upon body contents. Conversion of bilirubin to biliverdin in the presence of formaldehyde and eye enucleation discolorations. Decomposition changes. 1. Postmortem discoloration due to action of bacterial and/or autolytic enzymes on body tissues. Progressive color changes in tissues. And treatments. See the stuff we talked about before. General treatment of discolorations of the blood. It's also called decomposition changes. You use sectional hypodermic injections of chemicals designed to bleach and preserve. The discoloration may be lessened in its intensity by applying surface compresses saturated with a proper bleaching agent. Conditions related to discolorations would be skin lesions. And the definition of a skin lesion is any change in structure produced during the course of a disease or injury. Like a skin lesion is also any traumatic or pathological change in the structure of the skin. Purpose is disinfect the lesion, prepare the lesion for post-embalming restorative treatment. Classification. For the purpose of embalming treatment, skin lesions may be grouped as follows. Skin unbroken but discolored gets the treatment. Skin scaling, as in exanthematous diseases, gets the treatment. Skin scaling, exanthematis. Okay. Skin broken, separated from the body, is also called abrasions, blisters, vesicles, skin slip, such as this is classifications of the skin lesions. Treatment. You puncture and drain the blisters, but do not remove the skin. In other situations, you might have to remove loose skin. Apply sectional embalming, either arterial, hypodermic, or surface compresses, or all three. Use restorative art after embalming. Pustular or ulcerative lesions include boils, carbuncles, furuncles, ulcers, pustules, fever blisters, and herpes. Those are pustular or ulcerative lesions, boils, carbuncles, furuncles, ulcers, pustules, fever blisters, and herpes. Treatment is you aspirate pus from the papule or pustule. Pus is, the definition is a liquid product of inflammation containing various proteins and leukocytes, also called a pustular lesion. Characteristic pus field structure of a disease such as smallpox, syphilis, and acne. Swab the pocket of the aspirated or ruptured lesion with the proper disinfectant. Apply sectional embalming, either arterial, hypodermic, or surface compresses, or all three. Use restorative art after embalming. Other conditions include refrigeration. Refrigeration dehydrates. Hanging can create a condition of separation of the walls of the arteries. Don't get between them. You may stretch the neck. Burns. Burns, it's categorized as first degree has redness. Second degree has blisters. Third degree has charred flesh. Fourth degree has exposed bone. Again, burns. First degree redness. Second degree blisters. Third degree charred flesh. Fourth degree exposed bone. Poisons. If they vomit it back up, there may be chemical burns around the mouth if they were poisoned. Trauma. Gunshot. With gunshot, there should be powder burns. Carbon monoxide causes the cherry red color that will go away with embalming if you get it early. Drowning. You'll have petechia, moss growth, and could have been fishes feeding on the tissue, so the tissue could be messed up. Exsanguination. That means no blood in the body. It leaves the person with milky white skin. Electrocution leaves burn marks and internal tissue swelling. Vascular difficulties. include. Conditions predisposing include. So conditions predisposing vascular difficulties include atheroma. That's fatty deposits. Fatty deposits are atheroma. Arteriosclerosis is thickening of the arteries. Arteriosclerosis is thickening of the arteries. Varices is varicose veins. Varices is varicose veins. Clots, emboli, which is anything floating in the blood. Phlebitis, which is inflammation of the vein. Thrombosis is a stationary emboli. Hemorrhage is rupture of the vein. Endocarditis means inflammation of lining. Tuberculosis is the lungs. The lungs will be full of fluid. Febrile diseases cause a high fever and dehydration. Tumors are blood-filled swellings. Tumors are blood-filled swellings. Freezing causes dehydration and edema. Gangrene includes dry, wet, and gas. Gunshots. These are all conditions predisposing vascular difficulties. Trauma. Wound caused by force or violence is a trauma. Severances, reattachments. Asphyxiation. That means insufficient intake of oxygen. Pneumonia, fluid in the lungs. Burns, first, second, or third degree, causes vascular difficulties. Notice it's just first, second, and third. With fourth, it's already to the bone. It's gone, I guess. Syphilis, leukemia, petetia, hanging. Shock. Shock causes restricted capillaries. And advanced decomposition, it says to just bag them. Vascular difficulties are off the charts. You're done. Treatments for intravascular difficulties include strength, type, and quantity of chemicals. Pre-injection, you use low index, low HCHO. Vascular injection. With advanced decomposition, you use hot water or waterless. With advanced decomposition, you use hot water or waterless. Use a large quantity of solution. Supplemental chemicals. Fluids containing quantities of certain chemicals sufficient to supplement the injection mixture previously diluted. So you use supplemental chemicals. Moisture retaining chemicals when necessary, which are the humectants. And then for intravascular difficulties, there's also mechanical and manual aids like reduced pressure and rate of flow. You utilize care in raising the vessels. You use gauze or similar heavy material to tie off vessels to prevent cutting or damage. Use of various distribution and drainage aids. Manipulation of appendages. Massage. Proper selection of size and type of injection and draining tubes. Largest possible, but don't force. Then there's controlled injection and drainage. You use alternate injection and drainage or intermediate drainage as indicated. Use low pressure. Use arterial and venous injection may be necessary. Arterial and venous injection may be necessary. That's a new one. I've never heard him talk about injecting into a vein before, but I guess that's intravascular difficulties specific. And you also can hypodermically inject. You can use sectional arterial injection also. Extravascular difficulties. Sectional hypodermic injection used as supplement to arterial embalming is what you can use for extravascular difficulties, or sectional arterial injection. You can use operative aids, but you have to obtain written permission to use operative aids. And operative aids are necrotic tissue excision, swollen tissue excision, and new growths excised. Also, you can use surface compresses in the case of skin slip. With decomposition, there are conditions predisposing to decomposition, which include edema, peritonitis, which is inflammation of the peritoneum, the membranous coat lining the abdominal cavity and investing the viscera is the peritonitis. I might have said that wrong before. Burns in the second degree predisposed to decomposition. Gangrene, trauma, advanced pregnancy, febrile cases, septicemia predisposes to decomposition, and septicemia is a condition characterized by the multiplication of bacteria in the blood. Treatment of bodies predisposing to decomposition includes paying attention to strength, type, and quantity of chemicals. You use a large volume of arterial chemicals, and you use supplemental chemicals. Supplemental chemicals are fluids injected for purposes other than preservation and disinfection. Supplemental fluids generally fall into one of three categories: pre-injection, co-injection, and humectants or restorative fluids. And then you also increase solution strength for bodies predisposing to decomposition. You can also use mechanical and manual aids such as pressure and flow, and use of various distribution and draining aids. You can use controlled injection and drainage, which is the use of constant flow and intermittent drainage. And you can use vascular injection if possible. You can also use sectional vascular injection. You can use sectional hypodermic injection. All areas, which you use the sectional hypodermic injection for all areas not reached by vascular injection. Treatment of bodies where decomposition. Treatment of bodies where decomposition is present. Strength, type, and quantity of chemicals is what you pay attention to when there's decomposition. So you use a high preservation demand fluid, you use a large volume, you include surface embalming, and hot water is recommended for fluid dilution in advanced decomposition. Mechanical and manual aids for this. The use of various distribution and drainage aids and hypodermic embalming, sectional vascular embalming, sectional hypodermic embalming, and you can use operative corrections when decomposition is present. And operative corrections, it includes excising swollen areas when necessary and trocar aspiration. Those are operative corrections for decomposition. You use protective materials such as gauze bandages, plaster of Paris bandages, manufactured rubber garments, rubber sheeting, plastic sheeting, and cotton. You use special chemicals like hardening compounds, deodorants, sealers, reducing and bleaching agents, and disinfecting chemicals. The next problem is dehydration. There's conditions that predispose to dehydration, and this includes hemorrhage, febrile diseases, emaciating diseases, burns, and refrigeration. Those predispose to dehydration. And lo and behold, AIDS predisposes to dehydration too. AIDS, dehydration. And the definition of AIDS is a specific group of diseases or conditions which are indicative of severe immunosuppression related to infection with the human immunodeficiency virus, HIV. Persons dead having had AIDS may exhibit conditions such as wasting syndrome, extrapulmonary tuberculosis, and Kaposi's sarcoma. Treatment for dehydration, you pay attention to the strength, type, and quantity of chemicals. For the primary injection, and you use a large volume, you dilute the solution, you use coordinating chemicals, you use moisture retaining chemicals, and you use cold water for fluid diluting. So dehydration, you use cold water. Decomposition, you use hot water. That's so strange. Zombies like jacuzzis. Zombies like jacuzzis. Dehydrated people like cold water. I don't know why. Mechanical and manual aids for dehydration. Use liberal application of massage cream. You use light massage. Use of various distribution and drainage aids. Use hypodermic tissue fillers. Controlled injection of pressure and rate of flow. You also use controlled injection and drainage, as in constant flow and intermittent drainage. Alternate injection and drainage. You can use either one for dehydration. Constant flow and intermittent drainage, or alternate injection and drainage. Next issue is body fluid accumulation, which is edema. And there's lots of conditions that are associated with edema, such as phlebitis, congestive heart failure, cirrhosis of the liver, renal failure, which means kidney failure, lymph vessel obstruction, such as with cancer or parasites, carbon monoxide poisoning, burns of the first and second degree, alcoholism, trauma, steroid therapies, and allergic reactions are all conditions associated with edema. Fluid accumulation according to location. Anasarca is generalized all over the body. Anasarca is generalized all over the body. Ascites or ascites is the abdominal cavity. Ascites is abdominal cavity. Hydrothorax is thoracic cavity. Dependent edema is gravitation of fluids to the lowest part of the body. Hydropericardium is abnormal accumulation of fluid within the pericardial sac. Hydropericardium is within the pericardial sac.
Hydrocele is abnormal accumulation of fluids in a sac-like structure, especially the scrotal sac. So dude's balls. Hydrocele. Embalming complications with edema, distension of tissue, increased secondary dilution of fluid, possible desquamation, distortion of body contour, and possible leakage. Embalming treatment for edema. The mechanical aids include elevation of extremities to allow for gravitation of edematous fluid, elastic bandage to force liquid from extremities before, during, and after injection. Type, strength, and quantity of fluid, 3 separate procedures. A mild injection of a large volume may be used to help displace and wash out edematous fluid. Astringent solutions may be used with reliance upon secondary dilution to preclude tissue burning. Effect maximum physical removal of edematous serum and inject normal strength solutions. You can also do possible sectional embalming by direct hypodermic injection. Those are mechanical aids for edema. Another issue is deformities and malformations. Conditions causing deformities and malformations include paralysis, neoplasms, which are tumors. Neoplasms are tumors. General decomposition, hanging, trauma, crush injuries, which the crush injuries are the hardest type to deal with. Corrosive poisoning. In that case, the lips may be gone. That sounds like a bitch. Corrosive poisoning, the lips may be gone. And 3rd-degree burns means destruction of cutaneous and subcutaneous tissues. They might be seared, charred, or roasted. Arthritis, congenital conditions, and compound fractures. Compound fractures are where bone exits from the skin. To treat it, you push it back in and treat the open wound. Treatment for deformities and malformations. Mechanical and manual aids to correct deformities require written authorization. You have to obtain written authorization to use mechanical and manual aids to correct deformities. Operative aids to correct deformities. You also need written authorization. It should be obtained, it says. It says should be obtained. Maybe it's not like a must. It says should be obtained. Tendons may be cut and a splint of plaster of Paris bandage should be used to hold the limb in the correct position for proper casketing. Sectional vascular embalming is also a treatment. And strength and type and quantity of fluids may vary as to the type of deformity. Next thing is radiation. It says refer to state law. Refer to state law about radiation. General consideration. If a patient comes to emergency surgery or dies shortly after having received a large internal therapeutic dose of a radioactive isotope, the handling of the body may pose problems of radiation exposure for the surgeon, the pathologist, or the embalmer. It is important for members of these groups to realize the existence and magnitude of this problem and to know how to meet it. It is equally important not to exaggerate the danger and not to be unreasonably fearful when the hazard is minimal or non-existent. Inquire about site of needle implants, if any. So treatment in radiation situations. High levels of radiation can occur during treatment of malignant diseases and through occupational exposure. Patients receiving large doses of radioactive isotopes must be hospitalized until the isotope content is not more than 30 mc. The millicurie mc is that amount of radioactive material in which 37 million atoms disintegrate each second. In bodies that die outside the hospital, the funeral director should not encounter more than 30 mc of radioactive isotope. If such a body is embalmed without an autopsy, use standard aspiration and injection methods. The hazard is minimal. If the body's radioactivity is above the level of 30 mc and there is not an autopsy, the body should be embalmed in the hospital morgue under the direction of a radiation protection officer. What? The supervision in an institution licensed to use radionuclides that have the responsibility to establish procedures and make recommendations in the use of all radioactive matter. If a body contains appreciably more than 5 mc of any radioactive isotope and there is to be an autopsy, an embalming following the autopsy, it should be done only under the advice of a radiation protection officer. If the body is to be interred or cremated without embalming, there will be no radiation hazard from external handling. Personal hygiene for the embalmer. Rubber gloves should be worn throughout the entire embalming operation, as should a very heavy rubber apron. Utilize large quantities of running water at all times during the embalming to flush drainage matter. Minimize the time of close contact with the body. Special care should be taken to prevent the floor from being contaminated. Care should be taken that all body fluids are properly discharged down the drain. In case of overflow or spillage, fluid should be taken up immediately using disposable goods. Instruments should be soaked in good soap or detergent, then rinsed well with running water. Gowns, towels, clothing, etc. should be monitored and stored for suitable decay before being sent to the laundry. Waste material should be collected in a suitable garbage bag and disposed of by incineration. Waste material disposed of by incineration. Gloves should be thoroughly washed before being removed from the hands. Wash your gloves, then placed in a container of soap and water and allowed to soak and then stored in a suitable place until the radioactivity has decayed to a safe level. If the embalmer suffers any introduction of material from the body into lesions, he should wash the injured area copiously with running water and thereafter consult with his physician or a radiation safety officer. Examples of substances used in diagnosis and treatment. Cobalt 60, iodine 131, phosphorus 32, radium 226, gold 198, SR 89. Preparation of the infant. An infant is a child less than 1 year of age, by the way. Infant is a child less than 1 year. Special considerations for non-viewable remains. Positioning of the infant. is a special consideration. Methods of preservation, appearance of the prepared body, pre-embalming considerations, feature setting. The mouth will be slightly open and puckered, and body positioning is pre-embalming consideration also. Embalming considerations, use the abdominal aorta on the infants. Stillborn infants and those which die soon after birth use the abdominal aorta. Babies up to 1 year of age, children from 1 to 5 years of age. Post-embalming considerations, closing and sealing of incisions, cleaning and disinfecting procedures. Treatment of the body to be shipped. Should get a body to be shipped should get embalming analysis, and embalming considerations include primary disinfection, feature setting, embalming solution strength and volume, and cavity treatment. Post-embalming preparation, incision closing and sealing, treatment of all orifices, terminal disinfection of the body, leakage precautions, plastic protectors and coveralls, etc., stabilizing techniques in the casket or shipping case, embalming documentation, international considerations, preparation of obese bodies. You have to increase solution strength, increase solution volume. You potentially have to use multi-point injection, and hypodermic injection may be required to supplement vascular embalming. Woo! Okay, so that is all of the section of the Taggart notes about embalming. I'm going to make a next video that is just the embalming glossary. I'm going to have that separate because next is just embalming glossary, and it's long.